Good afternoon, everyone. Let's go ahead and call this meeting to order of APCD Governing Board regular meeting, the meeting of August 14th. Apologies for the delays for staff, members of the public. We did lose quorum at one point, so we got it back. So appreciate everyone for participating here. With that, I'll go ahead and ask the clerk to call the roll.
Thank you, Chair Bush. Before I call the roll, I would like to note for the record that members Fitzgerald, Gomez, and Lawson-Reamler will be absent from today's proceedings. I would also like to note for the record that member Campbell will be joining us virtually as permitted by the Brown Act under just cause due to physical disability. Member Campbell, can you please confirm that there is no one present in the room with you that is 18 years of age or older?
I will be attending the meeting today remotely. Pursuant to the Brown Act, I'm disclosing that there is one person 18 years of age and older present in the room with me. He is a member of my staff. And I will update this disclosure if that changes during the course of the meeting.
Thank you. All remaining board members are participating in person. With that, Member Aguirre?
Here.
Member Birkbeck Garcia?
Here.
Member Chair Bush?
Here.
Member Campbell?
Here.
Member Duncan? Member Gloria? Member Koval? Member Stigler-Granados? Thank you. We'll now move on to non-agenda public communication. This is an opportunity for members of the public to speak to the board on any subject matter within the board's jurisdiction, but not an item on today's agenda. We have one request to speak on this item. I would call forward Robert Gurman. You will have 3 minutes to address the board. Please begin by stating your name for the record, and please use the timer that is on the screen to self-regulate your time.
Robert Gurman, Citizens Against Gillespie's Expansion Low-Flying Aircraft. We're requesting the board to study the options available to them to stop the poisoning of our children and pregnant mothers from the storage, fueling, and use of leaded avgas in small propeller planes at our airports in San Diego County. For 70 years plus, our county has seen our population increase around these airports. The city and county is even encouraging these increases with ADUs, but has not addressed the problem of leaded fuel associated with the use of these airplanes at our 16 airports. These small single-prop planes dispense leaded fuel over our neighborhoods and schools. There are no safe levels of lead. Leaded avgas does not burn up in use. 95% of lead which goes into these planes comes out the exhaust and into the air and eventually onto the ground. Lead is a documented toxin. We should have zero tolerance on the use of leaded avgas in San Diego County. Not all of San Diego County 16 airports are heavy polluters, but combined, we are #1 in the nation for lead pollution from leaded avgas. Carlsbad and Oceanside airports are 3 miles apart with predominantly flight schools and skydiving schools. These businesses are heavy polluters. Montgomery and Gillespie airports are 9 miles apart and both have high numbers of flight training operations, hence heavy polluters. The closest proximity airports are hotspots. We are asking the city and county to acknowledge this poisoning and take action. The board has options that other municipalities have taken. Those options are banning the sale of leaded avgas. There are 3 grades of unleaded avgas that are available. Closing or moving the airports to less congested areas, limiting operations, especially commercial intent flight training, which are the worst for poisoning us from above. No long-term leases, no cheap rents, no expansion at airports, no issuing of building permits for ADUs, no increase in airspace, use tax and or user fees at our airports to pay for studying and implementing a leaded avgas mitigation plan. This should be a local plan. This plan does not come from Washington, D.C., aka the climate denier king, or his cronies at the FAA. This plan comes from local people sitting on the people sitting on the board with input from its concerned citizen. This plan is classified as an emergency. The Tijuana sewage problem is being discussed today in 2 agenda items. Another is charbroiling. We are asking that at every future air pollution control district meeting, we get 1 agenda item discussing a mitigation plan on leaded avgas. The people of San Diego County and our children deserve that. Thank you.
Thank you. That concludes public testimony on this item.
All right, with that, we'll move on to item C, approval of the June 12th, 2025 statement of proceeding, the minutes. And clerk, is there any members of the public wish to address us on this item?
Thank you, Chair Bush. I would note for the record that per the Governing Board Administrative Code, requests to speak are no longer accepted for this item, and that we have received no request to speak for this item today.
Okay, and I did forget to mention for the non-agenda public item, were there any item or anyone online that was?
We did not receive requests to speak for anyone.
Got it. Okay. So with that, any board members have any questions on the minutes? Seeing none, can I get a move to approve?
Excuse me, I move.
Okay, motion by Vice Chair Garcia, second by Member Gloria. All those in favor, please say aye. Any opposed? All right. Then no abstentions.
Thank you. With members Fitzgerald, Gomez, and Lawson Reamer absent, that motion passes with those board members who are present voting aye.
All right, with that, I'll go ahead and turn it over to staff. Item D1 on the agenda, it's the Tijuana River Valley Sewage Emergency, a presentation from our San Diego Public Health Services assessment on the chemical exposure. This is an info item. With that, Paula?
Sure. Thank you, Chair Bush. This item relates to an assessment of chemical exposure, or ACE, community survey that was conducted last fall in response to the transboundary sewage crisis in the Tijuana River Valley. The County of San Diego worked with the CDC Agency for Toxic Substances Disease Registry to complete the survey and recently received the results from ATSDR. The county has been broadly publicizing those results, which show the toll that this crisis has taken on the everyday lives of community members in the area. I want to thank the county for their work on this and introduce Dr. Thihalo Lipavan, County Public Health Officer, who will provide today's presentation on the survey results.
Thank you, Paula, and good afternoon, board. My name is Seon Thihalo Lipavan. You said it really well. And I am your relatively new public health officer that I serve as for the entire county. And as mentioned, we're going to go through quickly the results of the ACE survey, the assessment of chemical exposure. And if you can go to the next slide, I just wanted to start just by laying, by setting the table and just saying that as a reminder, right, this is the only local emergency that we at the county and many of our city jurisdictions have actively open right now, and that we keep renewing, in terms of the emergency status of this. We firmly believe that no one should live, work, or play next to contaminated water or rivers or oceans with sewage or pollution or other contaminants. And so we want to continue to do everything we can to address the underlying issue, but also mitigate the impacts while this continues to happen. Next slide. So now going on to the ACE study, just a quick overview of what the goals and objectives are. The goal is to assess the individual level impacts through an online survey related to the sewage exposure. And the objectives are right in front of you to understand the concerns, beliefs, and attitudes of air and water and exposure from contamination. And not only look at people who live in the area, but also people who work and recreate in those areas. And next slide. Many of you were familiar and have heard of the Casper study a few months ago. I know we had presented that to multiple audiences, of which some of you were in some of those meetings. And so just to compare a little bit and contrast what the difference are, between that federal health survey that was led by the CDC and this one that was also led by the CDC and another organization called the ATSDR, the Casper was a randomized sampling methodology of household surveys, which required in-person interviews for only residents, in which it captured the child and youth data as part of that household response. It was timed immediately before the ACE had started and sampled around 189 households in Imperial Beach, Nestor, and San Isidro, whereas the ACE was individual, self-administered, not only included residents, but also workers and visitors, and parents and guardians were allowed to answer a whole survey on behalf of their youth. And then we had, and we're really proud to say, and with many partners, including Paula and others here, Paula, the researcher, we were able to get to almost 2,100 completed surveys, and want to also point out that the location of the catchment area for the survey was expanded to also include Silver Strand, Coronado, and Otay Mesa West. Next slide. So just to get into the results, we'll start with the demographics and then move into health and other findings. So as you see here, most of the people who did complete the survey were 18 and over, female, and then 24% or about a quarter reported having a high school education level or less, and 91% of individuals reported having health insurance. So this is why interventions like working with the managed Medicare or Medicaid plans has been important in terms of things like getting the word about your air purifier distribution program. Next slide. In terms of who completed the survey and how they identified in terms of their race and ethnicity, you see that 49% of individuals identified as Hispanic or Latino, whereas 41% were white, and you see the other categories following it. And I do want to just point out and acknowledge that it is important to make the surveys and as accessible as possible. And we did make a Spanish version of the survey as well, and of which 172 individuals did complete. Next slide. When we asked why people were in the impacted area to begin with, the overwhelming majority lived there. That was 86%. And then these categories are not mutually exclusive, and 21% said that they worked there and 31% recreated there. And on the right, you'll see a lot of numbers and circles, and you could see the overlaps and the Venn diagrams, if you will, between the three categories. Next slide. When we asked the workers if they had direct contact, 25% of workers did say that they had direct contact with the contaminated river or beach water. And you could see the occupations listed there on the right side in terms of who those were. And I think probably not to many people's surprise, that was protective services kind of was the leading group, which included things like groups like lifeguards, firefighters, et cetera, and park rangers, and you can see the list. Next slide. And then in terms of thoughts, concerns, and experiences, if you can go to the next slide, we asked, how concerned or were you concerned or very concerned about the sewage crisis? And we found that 92% were very concerned about the sewage crisis. And then what's not listed there is another 6% were concerned about the sewage crisis. And then we asked in terms of other more specific categories, 97% were concerned about air quality, 96 on beach water quality, 94 on Tijuana River water quality, 86% interestingly were concerned, reported being concerned about drinking water quality, which I'll get to later. And then when we look at all four of those categories in totality, 82% reported concerns on all of those. Next slide. When we asked about changes and impacts on their daily life in the last 30 days, you could see in the left side that 80%, when you add the two non-gray categories, said that they had made changes to their daily life, right? This is impacting people and their behaviors and their livelihoods. And you could see that 36 said many changes, and then 44 said some changes in their daily life in terms of their activities and routines in the last 30 days. And on the right side, you could see that also 80% said that they took extra steps to avoid the area, and 20% saying that they did not. Next slide. Of those who said that they did notice a sewage smell, which was, I believe, 92% of the people who responded, you could see in descending order the actions that they took to reduce the sewage smell, starting with, or the most popular thing was closing windows, followed by air fresheners, candles, incense, oil, air purifiers, cleaners, filters, ammonia, bleach, humidifiers, and none and other. And I just do want to, since we are at the Air Pollution Control District meeting, I do want to point out the candles, incense, oil, to me and to many of us, I know is another concern, because while that may help with the odors, for example, or other things, it may also lead to additional compounds being created and released and affecting the quality of your indoor air. Sorry, next slide. When we asked about beliefs of the sewage crisis, you can see here that 67% said that it was not safe to visit, work, or live in the impacted area, whereas 7% thought it was safe. On the right side, you could see that 83% of individuals thought that the cleanup was not adequate, whereas 7% said that it was adequate. Next slide. When we asked about drinking water when in the affected area, we asked, what was your primary source of drinking water? Meaning, like, what do you drink most when you're in the impacted area? And 70% said that they drank bottled water, whereas 21% said that they drank the tap or the city water, and 9% said other. So again, I'll get to some of the water stuff later. And then on the right side, 63% said that they did filter their drinking water. Next slide. And then this slide I know has a lot of numbers and things going on this slide, but one of the main takeaways is that 92% of individuals reported noticing a sewage smell in the last 30 days. And of those who noticed it, you could see the different frequencies of how often they noticed it, rarely, sometimes, usually, or always, and the totals on the right. And if you go to the next slide, what's really fascinating, unfortunately, is that when you look at the frequency, the more frequent the smell was reported, the more likely it was to be severe. So you could see that kind of that very clear association, in my opinion, right here. Next slide. And then similar to the people who worked in the area, when we asked, generally speaking, if participants reported had direct contact, 24%, or also almost a quarter of individuals, reported direct contact with contaminated river or beach water. Next slide. And then now just moving on to health, including physical and mental health. Next slide. So when we asked, did you have a new or worsening health symptom in the last 30 days that you attributed to the sewage crisis, 64% of individuals said yes. And the leading symptom that they acknowledged was headache, and then followed by many other things that you see there. But I'll say, just as a category, what really sticks out to me is respiratory symptoms, as well as some of the other things that you see there. Next slide. And when we talked about or asked those individuals who did report one new or worsening symptom, if they sought medical attention, 31% of those individuals did seek medical attention because of those sewage symptoms, and the majority of which sought the care in the outpatient setting, 72%, and these are not mutually exclusive. Some people could have sought care in multiple settings, and then 36% sought care in a hospital emergency room or urgent care and were released, while 7% sought care in those settings and were admitted, and 3 people actually told us that they were admitted to the intensive care unit, which is the highest level of care needed. Next slide. In terms of mental health, next slide, this was significant, where 65% of individuals felt that their mental health symptoms were related to the sewage crisis. If you can go to the next slide, what we did as part of the questionnaire, these federal data and the federal questions included questions on the screening tools that you or I or many of us have fill out in our doctor's offices while we're in the waiting room. And so this was a screening tool on anxiety. And the next slide we'll have on depression. But on this slide, you could see that 28% of participants scored high enough on the anxiety screening tool that indicated likely clinical anxiety in the last 2 weeks, right? These are validated screening tools. And then what is also interesting is that the individuals who said that they reported a severe sewage smell that they noticed on a few slides ago scored higher on these screening tools. And you can see that number is 35% there. And if you go to the next slide, on the depression screening tool, about a fifth of individuals scored high enough that indicated that they had major depression in the last 2 weeks. And again, there was that association where people scored higher, unfortunately, if they did report a more severe sewage smell. Next slide. And so the key findings of all these, and of course we have a lot more on our webpage that you can look at, et cetera, but really is that people are suffering, the community is suffering. Most people are concerned about the air quality, and 86% concerned about tap water quality, interestingly. And most people noticed a sewage smell, and many of them, 57%, said it was severe. You had almost a quarter of individuals reporting direct contact with contaminated river or beach water, and then over half, for 64%, reporting one new or worsening physical health symptom in the last 30 days, of which 31% sought medical attention for that. not listed here, but 65% of individuals said that they had mental health symptoms attributable to the sewage crisis. And then we see the numbers at the last dot point of the people who screened high enough on the anxiety and depression screeners that indicated likely clinical anxiety and depression, respectively. Next slide. So I know I spoke about the Casper study at the beginning, and I really want to go back to this because this is another federal health survey. And as I mentioned, they have two totally different methodologies that are both validated, used, for various reasons across the country over time. And yet they found really, really eerily, but probably not unsurprisingly, very similar things, right? So it again echoes and shows us that the community is concerned, that the community is suffering, and we need to continue to take them and their concerns seriously, and address the root causes as well as mitigate the whatever we can while we're waiting for the root cause to be fixed. And also just wanted to point out the second last dot point, just because I didn't show a slide on it, that the preferred communication channels were similar in both surveys in terms of the responses, meaning word of mouth, TV, internet news, email, and text message were all things that avenues that people preferred receiving communication in. Next slide. And so really wanted to transition into what are we doing collectively, right? Next slide. One thing is that, no one of us entities can do it alone, right? Whether it's county government, city government, or any level of government and non-government, right? This is not just a government issue. This is an emergency. This requires an all hands on deck approach. And so we are trying to do that as best as we can. We've been meeting with the schools for months. We've been meeting with healthcare clinics, and we've recently expanded that to include some additional facilities, and are meeting pretty frequently every 2 weeks. And then we continue to have every month what we call an all agency meeting with agencies, governmental agencies at various local, state, and federal levels. And a few months ago, we did add the cities as well. And you could see the kind of exhaustive list there. Next slide. And, there are additional work being done in terms of just looking at this from a scientific perspective. I will point out that one of our researchers on your board is continuing to do a study, which is not listed here. And so she has an ongoing study where we're continuing to get, more current information about how people are experiencing this crisis. But then here, what you see in front of you is what's called a public health assessment. So the Agency for Toxic Substances and Disease Registry, who's the same group that worked with the CDC and conducted the ACE, is doing what's called a public health assessment. And this was in many part thanks to the advocacy of many of our legislators and electeds, really going to the federal government and asking that this be conducted. This is typically a 2-year process. And this is one where they look at samples like, lab samples like air and surface water, sediment, soil, as well as they'll look at APCD's odor complaint data to look at, how this all in totality shows a story of what is going on, what is not going on, and then what recommendations, where are the gaps in data, and what are the public health recommendations that additionally, is important for the region to understand. So if any of you want to just be kept up to date on this process, please email Ben, and as you see there. Next slide. And then, we know that this is an emergency. We have declared this an emergency locally. Our cities impacted mostly have declared that most closely have declared this an emergency. And really, we want the state to declare this an emergency, right? We know that will also be even more helpful in addressing the problem long term. And so I know after the Casper results, our interim health officer asked the state health officer to declare an emergency. There's been a new health officer at the state level and of course locally. And so 2 weeks on the job, I asked the new health officer at the state level also to declare an emergency, because now we have additional justification. We have months of monitoring data from APCD as well as these federal health surveys to help justify really the need. Next slide. And then just wanted to talk about the drinking water. The overwhelming majority of people were concerned about drinking water, and especially, and many of them are drinking bottled water. We know that people can choose, of course, if they want to drink bottled water, but we also know that some of the impacted communities are socioeconomically disadvantaged. And so to spend money on something like bottled water where may not be necessary, is something that we want to raise awareness about. And so we wanted to raise awareness and make sure that residents knew that the water coming out of their tap has nothing to do with the Tijuana River Valley, right? There's no sourcing from the river or anything like that. There was a boil water advisory a while ago, but that's been since done, and that was when the storm happened a little while ago. So but we have water agencies that routinely test the water and share reports around this. So we've been working with the water agencies last year and more recently to try to make sure that they continue to more proactively educate the community, increase the frequency of the testing, and really socialize that and reassure their residents that their water is not related to the Tijuana River Valley. Next slide. And you saw that the mental health concerns were also very significant. So we've been working with our sister department, Behavioral Health Services, to, of course, get the word out and continue getting the word out around publicly available resources, and even partnered with them to have very specific discussions, like discussions with schools where some of their contractors are, who can do more outreach to the families in that impacted area. They're joining me, for example, in a South Region community leadership team meeting that's focused on behavioral health that's coming up, where we're gonna talk with a lot of our local CBOs in South County about what else we could do, for example. Next slide. And then, of course, APCD has started a monitoring network last year, and we do have data available and months of data available, and they do issue air quality advisories and updates, and they do have the air purifier distribution program, and you see it right in front of you, the real one. And so we, of course, promote that. And if you can go to the next slide, since last year, we have been promoting with the flyers and everything, working and collaborating with APCD, at many events. You see there are 342 community events reaching over 16,000 residents. More recently, at the request of Paula, we have been working and using our community health workers to actively enroll individuals for this benefit. And we're working with the team, and thank you for the team behind me, to really help and let our community health workers be part of that solution, and also work with people, because there's nothing that can substitute or replace the in-person assistance that is very helpful from a trusted messenger like a community health worker. And so we've also have another team who's doing phone calls and emails and door-to-door efforts specifically for in-home daycares. There are many kind of subpopulations that we are concerned about, are a little bit more vulnerable maybe than the general population, and daycares and youth and students are really some of those populations, and people who operate in-home daycare centers, whether they're licensed or not, are already eligible for your air purifiers. So we want to make sure that they are, and we've been actively trying to help with that. With the ACE survey, one of the wonderful things and things I'm most proud of is that we're actually able to reach and email the people who filled out the survey to thank them. Usually you fill out something and you don't get a response. And so this is best practice in what's called community-based participatory research to get back to the individuals about their impact. And but that allowed also me to put in, or us to put in, a line about there and language, not just about this air purifier, but also about that their water coming out of their tap is not sourced from the Tijuana River Valley. And then, of course, we continue to link APCD with other county partners, as you see there, and promote this. Next slide. And we continue to do many communications. We've had many different organic or paid kind of ads and posts and things like that on various social media platforms, Facebook, Instagram, Nextdoor, in English and Spanish, that you see has gotten over 320,000 social media impressions. And we will continue to do that. Next slide. And we've worked with UCSD's one of UCSD's groups to create what's called this environmental dashboard. This is a kind of a one-stop shopping, pulls multiple sources of information. We've gotten very positive feedback from individuals about this, but yet, this is another thing that I don't know that everyone who probably wants to be aware of this is aware. So we continue to promote it. Next slide. This is just a sampling of some of the communication plan around the ACE that we continue to do. And again, there's other things beyond these groups. Next slide. And then just want to talk about the hotspot. So even if you look on Google Earth, you could see near Saturn Boulevard, the foamy area, or it'll be white when you look at Google Earth. And what we see there is a result of a drop in the water flow, which causes the foam and the friction and that turbidity, which we believe, is causing more aerosolization of some of the chemicals, including hydrogen sulfide. And we detect that because APCD's sensor is right at Berry Elementary. We have some UCSD researchers who've measured right there at the spot directly and seeing higher levels, right? So there's multiple kind of sources that we have that are telling us that this is the hotspot. And so we've been working with the city of San Diego and the Navy, because this is not county-owned property, to help with that mitigation. In the fall, we worked with them, and there was one intervention that was done. It didn't make it worse, but it really, unfortunately, did not help as much as we had hoped, or helped really, and made any noticeable difference. So we reconvened the group and expanded it to include the International Boundary and Water Commission. And we are continuing to collaborate and pursue potential mitigation options. And we have some ideas that we are actively pursuing. Next slide. And just a continued reminder that this is the county's website on this, and there's many different resources on this. So please take a look whenever you can. Slide. Resources. And then just in closing, ultimately the root cause is what needs to be addressed. And we talk about the Tijuana River Valley, but there's some sewage that doesn't even make it up to the Tijuana River Valley and really goes through the side right to the ocean. So there's many different infrastructure fixes that need to happen, and some that are being actively worked on, and timelines that have been accelerated. And we are grateful for that. But again, we are in an emergency state, right? We need to do everything we can. That needs to be expedited. We need to do more. And so while we're focusing on the root cause, we need to continue to support the health of the community and the wellness. So I'll close with that and open it up to any questions, please.
Okay, thank you. And it's Dr. Thilali Pavan?
Yes.
Okay.
You can call me Seon. It's fine.
Okay, Seon, thank you so much for all of this information. And I just have to tell you, from compared to last year, the county health response, I just feel like this is totally 180, and there's a much bigger acknowledgement of the crisis. Obviously, we have more data, so that helps a lot too. But I really thank you for being proactive and acknowledging, because I just didn't feel that same level of urgency and acknowledgement from the staff last year. And that's not to point fingers or the blame, but it's just I just personally felt that it wasn't at this level of care and detail and focus. So I just really want to thank you. And while you're up here, I wanted to turn it over to before we get to public comment, as board members that might have some questions for you. And I see we can, yeah. So if there's no, we can hold off on the questions for right now. So Marvis, do we have any members of the public?
Thank you, Chair Bush. We have one member of the public that has requested to speak on this item. We have a virtual caller, Truth. You'll have 3 minutes to address the board. Please use the timer that is on your screen.
Hey, it's Truth. First, I have a point of order. Last night, I signed up to speak on items D1, D2, D3, as well as non-agenda, and yet my sign-up and hand raise for non-agenda was not recognized. Why is that? But I'm going to continue on this item. I already heard this study 5 months ago. It's 5 months old. Why is it being heard now? Is that to give Paloma something to talk about? I actually forgot to do one of these surveys, which is too bad, since I have some fun stories about being negatively affected by Mexico sewage. When your community has been reduced to candles and closing windows, that's how you know your majority political party has failed the people they claim to represent. The party that claimed they cared about the environment has failed. It only took the county and CDC decades to care enough to do some pointless studies, because they sure haven't done anything else. Has anyone asked why the county suddenly got a new public health officer? Did the last one, Ankita, lie too much? If the county suddenly claims they want to take it seriously, then what are their tangible plans outside of studies? Why does Paloma's 5-point plan to nowhere talk about more studies when she actually admitted this?
4 different academic institutions have been taking plenty and thorough samples of soil, air, and water. The empirical evidence is there. We know what needs to be done.
A few moments later.
Obviously, the big area of need is doing an epidemiological study. There's nobody studying what is the correlation, if there is a correlation.
If there's a correlation, I mean, talk about trademark flip-flop. Instead of pointless studies, I'd prefer real plans to stop the sewage. Tariffs, border shutdown, sanctions, whatever it takes to produce immediate results, not plans where wait yet another 2 years to see Mexico fail again. Anyone who doesn't support such action is saying they don't really care that our country is being hit with an average of 25 million gallons of sewage a day, that they actually want to see it continue for another 90 years. Because the number one source of pollution is not the river, which is but a trick to make it an American-funded problem. The number one source of sewage pollution, the root cause, is Mexico, because you could clean up the river today and Mexico would just pollute it the next day. And we already have the numbers showing that the worst pollution levels are at the IB Pier, not the river. That's because the sewage is being dumped right into the ocean. We've paid enough in health for Mexico to catch up to the basic necessities and requirements on running a country to take care of their own people. The governor is not going to declare a state of emergency. A president cannot declare a national state of emergency without a governor's consent. So Trump could sign an executive order instead. However, the EPA has already released a long plan. It's not perfect. It's missing water reuse and reclamation, and it's missing accountability measures. But it's also the closest IB has ever been to a real solution. Because California politicians have failed the residents of Imperial Beach and surrounding communities miserably. The Mexico lawyers are actually worse than Mexico sewage. No more excuses on real action. No more playing nice with a foreign country who's polluted us for 90 years. There's not even one more year to have property values plummet, businesses close, and health decline. Thanks.
Thank you, Truth.
That concludes public testimony on this item.
Okay, thank you, Marvis. All right, with that, we'll go ahead and turn it back over to, and there's no other comments in person?
No,
In person?
we were speaking
Okay.
over.
Chair, I'm sorry.
Okay, thank
Did you want me to respond about the survey being old, or is that?
Yes, you could, and then we'll turn over to comments.
Okay, I'm happy
From the
to.
board.
Thank you, Truth. I think for the comments, I just wanted to say that, even though the survey was conducted right after the Casper in November, with the change in federal administration, there was a pause in activity at the federal level and communications. So we didn't even start seeing preliminary data until I think around May-ish. We didn't get clearance until either like really early in July, right before we started going public with this data, or the end of June. So there was a significant gap, and this is there's 2,100 individuals who completed the survey and many more who did not complete the survey. So this was a much more robust survey to analyze. So there was no delay in us sharing the data. Just want to be absolutely clear on that.
Thank you for that clarification. Appreciate that.
And also we do not need, even though more data is helpful from a health perspective to characterize what's going on and absolutely welcome, and long-term studies welcome, we do not need more data to act. We have more than enough from these 2 federal health surveys alone and what we've been hearing from the community to act, and which is, I know, part of what we're doing with the air purifiers.
Thank you. Okay, Member Aguirre.
Thank you, Chair, and thank you, Dr. T, for the presentation. Yeah, I agree with what you're saying. We do have sufficient data, and what a difference does 2 years make? Because 2 years ago, and I'll acknowledge this because it needs to be said, members of my own agency said there was nothing to worry about. 2 years ago, we asked for increases in hospitalizations or emergency department visits, and we were told at the time there's 0. We have also been told not even a year ago, it'll be a year next month, that the air was clean and that there was nothing to worry about. So I just want to acknowledge that the Casper study, the ACE study, and the SDSU study that's continues to be ongoing, I think it's a redemption for the people of District 1 in the affected area. Because for far too long, they have been raising the alarm over and over by reporting how their bodies are being harmed, how their mental well-being is harmed, how their quality of life is being harmed, how their bottom line and economic security is being harmed in so many different ways. So it's, I think these studies are in a way a win for the people, because now we actually have empirical data that shows that everything they've been yelling to the four winds is accurate, and it's true, and it's consistent among all the different studies that have been done. Now, to the point that was made earlier, yes, we do have this data, but there isn't a longitudinal type of study that has been done. And for those that may not be trained in science, they may not know the difference. And it's a very important difference, because we have this self-reported information that the community is telling us, but we need to also do our part and figure out exactly what are the medical interventions that will be needed based on actual hard data that will be collected in a longitudinal study. I have a lot more to say about that, but I won't at this moment in time, because I just want to highlight some of the information that was made in this study. 36% people reported going to the emergency room, 7% hospitalized. I cannot express how harmful and traumatic this experience has been for the residents, and you've seen in so many different ways. So I think that it's important that we continue to figure out interventions, both from this agency, from the county agency. I have a lot of suggestions that I'm going to bring up in the next item, but just wanted to mention for the record that this is a redemption for the people of the district. Thank you.
Thank you, Member Aguirre. Member Campbell?
Thank you so much. I just wanted to thank our new county supervisor for her outstanding understanding of this issue. And I just wanted to bring up the University of California, San Diego study by Dr. Prather that found that the wind currents carried norovirus from this pollution north and up the coast of California. It's very dangerous. In case we don't remember, that was the virus that was common on cruise ships a few summers ago, where everyone got so sick, and it's very it spreads very easily, and it goes on the wind. It's droplet, and so it's very important that we stop this pollution. And I'm glad that our supervisor from the South Bay is going to talk some more about this in the next item, because there are things going on. Finally, a lot of it due to her efforts, and I really appreciate her being on the Air Quality Board and helping us out with this, because we have got to make sure this stops. Thank you so much.
Thank you, Member Campbell. Vice Chair Burke Garcia?
Hi, Dr. T. I want to echo what Chair Bush said. I was really frustrated 11 months ago when we, at this meeting, discussed the concern for our families in District 1, and we were basically told it was safe. And I was very frustrated at that meeting. And as a physician, I was asking questions and I felt like they were talking in circles around the question instead of directly answering the question. And today you have answered the questions. So I truly appreciate that. It's been a very, very long year for a lot of us who are very passionate about making sure that our county stays healthy. I want to echo what Member Aguirre said about the number of hospitalizations, the number of individuals that sought medical attention. I agree with the need for longevity studies. And in future surveys, I would suggest that one of the questions not be just who sought medical attention, but who felt they needed medical attention. Because many members of our community can't afford their high deductible copays. So they don't get help, or they have to decide, am I going to take grandma to the doctor? Am I going to take the infant to the doctor, or am I going to take myself to the doctor? And so we know that there's a lot of people who wait to the very last minute to go to the doctor. There's also people who don't stop to think of the correlation of things. So like Member Campbell mentioned, the uptick in norovirus that the UCSD study was mentioning. There's been an uptick in pediatric hospitalizations, at least at the facility I work at, for GI illnesses. Now, the facility I work at does not test for norovirus, but when I send my respiratory panel, it comes back negative. So it's not enterovirus or adenovirus that's causing their GI upset. I don't know. But I have had an increased number of pediatric patients compared to the last 17 years that I've been practicing in San Diego. In the last year, we've had more GI hospitalizations, which makes sense because the wind does not stop at District 1. It doesn't stop in Coronado. The ocean also, there's no barrier in the ocean. So we are worried, and I am very worried. I mean, I grew up in the South Bay. Imperial beaches were closed more than they were open. Now they're never open. And these waters do come up where we may not have those high levels, but they do come up. And I think it's important. I know you know this, but I think it's important that the general public realize this too. This is not, yes, it is a District 1 issue, but it is a whole county of San Diego issue as well.
Thank you, Doctor. If you don't mind me responding a little bit. First, I would love to talk to you offline about some of what you're seeing. We have a healthcare meeting. If it's relevant, if you have time, we'd love to have you join. So inviting you to that. And then two is that you're absolutely right that it's a regional issue, and everyone is impacted, and especially when we talk economically. I've had family that chose to go to Orange County for vacation, visiting from out of town, instead of here in Coronado, for example, for July 4th. And so, there's so many impacts to the whole region, and I totally agree with you. I will say that, our team, just to speak to some of the comments, is that, this has been an evolution of work, right? We started off and responding to some of the concerns, the community, working with one individual clinic, looking at our data. Every data has limitations, right? And it's important to know that and acknowledge that. And so knowing some of those limitations, that's why we asked the federal, or my predecessors and the team asked the federal government to step in. And then with this now, we're hoping to even build on that with additional efforts. So this continues to evolve. I apologize if it wasn't what didn't feel, and people, if it wasn't as responsive, but I promise you that the team I work with, I feel and see that they are so responsive when I work with them daily.
Okay, thank you, Dr. T. Member Koval.
Thank you. I just have a communication question.
Of course, yeah.
What water districts serve
Yeah.
the affected area? Do you know?
There's 4. I don't remember the names of them. I apologize, but I'm happy to get back to you. I mean, we met with them, and they have they're 4 different agencies, so they have 4 different levels of engagement and responses when we ask them to proactively increase their responses and engagement on this. So some have more of a, for example, social media presence than others, or things like that, and engagement with the community. How much are people in general engaged with their water districts? Probably not exactly. Like, am I? Yeah. So, right. So,
Communication for the
you may have some tips that we could benefit from. I was going to say, yeah.
The best way for a water district to reach everybody, and the message is that your drinking water is safe, right?
Yes, exactly.
I think you want to communicate, is to put it in their bill insert, message in their bill insert, including their e-bill insert.
So we mentioned that and we discussed that, but one of the concerns that's at least some of them brought up is that, especially in places like Coronado, there's maybe more of a rental market. So then, they don't necessarily, the people living in the house don't get the bill. But I think that is one thing, and we have to probably do multiple things to get at everyone, right? So, yeah.
10 followers.
Yeah. Yeah, exactly. And they're probably like 9 staff.
Yeah.
So, yeah.
So bill insert generally will get to the majority of people.
Yeah. I'll follow up with them with that recommendation.
Member Granados.
Hi, thank you. Can you hear me okay? Thank
Yeah.
you for that presentation. I appreciate I've spent quite a bit of time looking through all of the data and looking forward to working with it some more. And I'm going to second what everybody else said. You know, a year ago, I remember I think I was at an APCD board meeting for the first time, giving my 2-minute like pitch about what the problem was, and I think I became physically ill at that meeting. And my own personal health I've been basically, from all the research that we've been doing in the field, have had my own personal health journeys, and I can't even imagine what people living there are dealing with. Mine is nothing compared to the thousands of people. But having just, spent so much time at that hot spot inhaling, even with respirators, and all of our students and researchers are getting sick from this. And so the people living there, they deserve, to have their voices heard. And I do believe that this has absolutely been important to hear their voices. I think we know that this is hypothesis-driven surveys that we're doing. So we're asking these questions like, what is it that's bothering you the most? What are some of the things we need to be concerned about? And I agree with you. We have enough data to say that there's a problem. And I hope we talk about this later. I think we will. But there's also a chronic exposure risk data that we need to really be considering, this longitudinal data. What are the chronic risks currently? Acute chronic risks that are acute chronic sounds like a little bit strange, but in terms of short-term chronic risks, long-term chronic risks, we have no idea. After, again, people have lived there for decades, this has been ongoing. It's not just been the last 2 years. It's just been exacerbated in the last couple of years. And so agree, we have to cut this, off at the head where the problem is, but it's not going to stop there, unfortunately. So I know hydrogen sulfide might have a short-term, risk associated with it, but all of the other toxins that we are now working with ATSDR to understand a little bit better, it's kind of a toxic soup that people are inhaling. And so I hope that we continue to work with deeper levels of data, encouraging not just the hospital data that we currently use for surveillance, but looking at some of those urgent care clinics, looking at Kaiser, their urgent care clinic facilities and things like that. I know it's difficult because surveillance data is hard to gather, but we can do a lot of like geospatial analysis and a little bit more data mining, I think, with a little bit more surveillance setup. And if this is a state of emergency, then we should hopefully get the support from our California Department of Public Health and other agencies to help support those efforts. It's not something that we have to attack and do this alone, but we should have the support of the entire state to do that. So I think we'll talk more about that, but I just wanted to thank you for the data that you did present, and I hope we can keep that momentum going.
Thank you, Dr. Granados, and thank you for contributing to the public health assessment with your data. That's super critical and just part of the larger kind of matrix of data that is needed to really understand the picture. Fully support and agree that we need to understand the long-term impacts of these low-level, often cyclical levels of some of these chemicals, whether it's hydrogen sulfide and what else we are not aware of. And so we have board action at the county already, working with our new supervisor, but even before she came on board, to continue and start looking into that. And so we are moving in that direction to look into that. We've already been identified as someone who will be partnering to as we continue to discuss what that could look like. So we appreciate that.
Thank you, Dr. T, for that response. And we're going to wrap this up here. So I think Member Aguirre had another follow-up question, and maybe Vice Chair Burpik Garcia.
Just really quick, it's a comment, Dr. Granados. So to your point about hydrogen sulfide only being an indicator type gas, we know that there could be an array of other gases that we're not even detecting. And that's the very concerning area for all of us, right? What is the long-term health exposure to all of this? So yes, the board has adopted the 5-point sewage plan. Be on the lookout. By the first meeting in September, I'm going to bring back the item in a much more expedient way because there's a lot more action that we could be taking, especially coordinating with all the hospitals and local clinics in a much more comprehensive, broader way than we have been, that the county has been doing so far, because there's a lot of missing gaps there that we there's a lot of data gaps that we're missing. So I think that's important to point out.
Thank you.
Just one other thing, going off of what Dr. Granados mentioned. As we know, this has been a chronic issue, and now we're seeing acute on chronic
Right.
problems. One of the things that was brought up 11 months ago was that on a daily basis, we weren't meeting the toxic levels or the concerning levels based on OSHA. And I've said this, so I sound like a broken record, but this is the first time you're hearing me say it, so I feel okay saying it, is OSHA standards are workplace standards.
Absolutely.
These are standards for people who come in and out of a workplace facility with proper PPE, so that's protective equipment. Those numbers should not be used for people who are breathing this day in and day out in their homes, in their jobs. And so that's another point of frustration for me is I know we don't have the data behind it. I've looked, unless there's new data that some of the researchers have gotten out within the last 6 months, but I haven't seen like studies on any of this. But I am concerned about these acute on chronic issues and long-term chronic effects.
Absolutely. This is a decades-long issue that has only been recently exacerbated. So definitely acute on chronic is a perfect characterization of this. And so fully agree. And sorry, I want to say EPA has some standards called AGLES, and so there are some other standards that are probably more appropriate than because workers have a different exposure and there's different tolerances for people who basically are voluntarily exposed, right? In a way.
All right, Member Granados, and we'll close up.
Yeah, I just did a really quick, I just call it quick and dirty analysis of the H2S data from APCD for low-level chronic exposures since we started collecting data back in October, I think, up until May, I think, or April, which is when I got the data. And I'm looking at Berry Elementary had chronic exceedances of greater than 10 parts per billion, 729 times during that time period, and acute peaks exceeding greater than 100 parts per billion of 72 times. Just in that very short time frame. So I think we can start now with the data that we have from APCD, start looking at, what are those chronic exceedances? And we've got several studies now that are out there that are showing, these are what we would expect at chronic levels to start seeing health issues. And so, as I said here, adverse effects occur at very low levels, usually at greater than 10 parts per billion, and short-term peaks greater than 100 parts per billion, causing eye, nasal, respiratory irritation, asthma exacerbation, and neurobehavioral symptoms. And so it really reflects what you're seeing in those surveys in terms of the numbers of exceedances on the little tiny bit of data that we have and the survey results that you got. So I'm not surprised, but we can keep talking about these numbers. I think it's really great that we have those monitors out there now. And thanks to, Kim Prather for her really encouraging us to get those out there. I'm really grateful for her doing that. But I think we're already starting to be able to use those numbers. And so if we can work with your data too, we can make some actual correlations.
Absolutely. And really, thanks to APCD's monitoring chief, Dr. Soderman, who's done some of that analysis for me at my request, and compared with the AGLES and the EPA data or levels or thresholds. So that's been very helpful. That was, when I asked the state to declare an emergency, that is part of the justification. Now we have monitoring data. We might as well try to use that to our advantage in terms of increased advocacy and understanding and characterization of the issue.
Great. Thank you, Dr. T. So thank you, county staff and APCD staff for this information in this presentation. With that, we'll move on to the item D2. So related, it's the Tijuana River Valley Sewage Emergency Air Improvement Relief Effort Program update and request for inclusion of public schools and daycare facilities. And clerk, could you please provide the public testimony instructions, and then we'll have the presentation from Deputy Director Mike Watt.
Thank you, Chair Bush. Per the Governing Board Administrative Code, the submission period for this item, the submission period for requests to speak on this item is now closed. All public testimony will be heard at the conclusion of the staff presentation.
All set?
Set.
All right, thank you. Good afternoon, Chair Bush and board members. My name is Mike Watt, Deputy Director here at APCD. Today I'll be providing an update on the district's Air Improvement Relief Effort, or IRA program, as well as a recommendation related to funding for air purifiers at public schools and daycare centers in the Tijuana River Valley. Next slide, please. For some background, at its September 2024 meeting, the governing board directed staff to develop a plan for funding, procurement, and distribution of air filters to help provide relief to residents in the Tijuana River Valley communities most impacted by poor air quality resulting from the ongoing cross-border wastewater crisis. In November of 2024, staff returned to the board with a plan and funding options to procure and distribute up to 10,000 air purifiers to households in the affected communities, and the board approved funding for this effort. The board also directed staff to prioritize vulnerable populations such as children, seniors, and those living closest to the source of the odors. Starting in December, staff organized preliminary distribution of air purifiers, working with community partners at Berry Elementary School, Montgomery Middle School, and the South Bay Boys and Girls Club. The online application portal for the Air Improvement Relief Effort launched in February 2025, offering direct delivery of air purifiers and replacement filters to households throughout the eligible area. Next slide, please. While the air quality issues impacting residents in the Tijuana River Valley cannot be fully mitigated without addressing the root cause of the issue, the IRA program aims to help provide some level of relief to communities by making air purifiers available at no cost. Households eligible to participate in the program are those located within the area approximately bound by Interstate 805 to the east and the San Diego Bay Otay Valley Regional Park to the north, and includes portions of the zip codes 91932, 92154, and 92173. This geographic boundary is consistent with the County of San Diego's August 2024 Air Purifier Pilot Program. Eligible households can apply online to receive 1 air purifier and up to 2 replacement filters at no cost. Applicants can upload proof of address information in the online application portal and have the purifier and replacement filters delivered directly to their door. This helps to ensure that purifiers are delivered to households in the most impacted areas and that California Air Resources Board geographic funding requirements are met. Given the limited funding available for this program, requests are limited to 1 per household. Next slide, please. APCD staff work with the California Air Resources Board, or CARB, to determine appropriate air purifier specifications to help provide some relief from the air quality impacts experienced in these communities, in particular the hydrogen sulfide odors that were discussed previously, while also considering various factors such as cost, size, maintenance requirements, electricity use, and availability of affordable replacement filters. Based on these factors, staff developed specifications to inform a request for bid, and the Aranci Mod Series air purifier was selected for use in this program. And you can see an example of the purifier that we have here in front of us. These purifiers include filters with activated carbon and potassium permanganate to help mitigate hydrogen sulfide, as well as HEPA filters to help remove fine particulates. They have the capacity to clean a space up to 1,700 square feet in 60 minutes, and replacement filters are simple to install. Next slide, please. To date, over 5,500 air purifiers and the associated replacement filters have been approved for distribution to households in the eligible communities. Feedback from recipients has been positive, with many noting an improvement in the air quality in their homes. Next slide, please. The funding for the IRA program include $2.7 million in interest earnings from the AB 617 Community Air Protection Incentives Program, a $160,000 one-time grant from the United States Environmental Protection Agency, $50,000 from the County of San Diego's Neighborhood Reinvestment Program, a $10,000 contribution from the City of Solana Beach, and just over $134,000 recently received from CARB as part of an application APCD submitted for supplemental environmental project funding. To date, over $1.3 million has been expended, and sufficient funding remains to purchase and distribute at least 4,500 additional air purifiers to households in the area. Staff projects having approximately $300,000 to $350,000 in funds remaining after distribution of the 10,000 purifiers planned for this program. Next slide, please. Our IRA program outreach through social media platforms such as Nextdoor, Instagram, and X, as well as door-to-door flyer distribution and partnerships with community-based organizations, schools, libraries, and other groups to help support direct community enrollment of the program is ongoing. Staff has coordinated with site partners at schools, libraries, and community centers to provide space, staffing, and outreach to host distribution and registration events. We also have recurring drop-in registration opportunities at libraries and community centers to help community members enroll in the program, often in conjunction with food distribution events to help support those most in need. Additionally, staff has conducted targeted registration events to help enroll sensitive populations at places like schools and senior living centers. These on-site registration events can help streamline the address verification process for both applicants and program staff. And as Sion mentioned earlier, we're also providing training to enrollment partners to help expand our network of support for program enrollment, and recently began working with the County Promotora team and the Public Health Services team so they can assist with applicant registration. So very appreciative of your team's support on that. Through these continued engagement efforts, we hope to see increases in program applications going forward so we can provide purifiers as quickly as possible. Next slide, please. Just some information on application statuses. On average, we're receiving about 800 applications per month, with that number peaking at about 1,200 applications monthly in the opening months of the program, and it's closer to about 500 per month since June of this year. We've worked to identify and implement program enhancements where we can and continue to look for opportunities to do so. For example, program participants overwhelmingly elected the option to have equipment shipped to their home address. So we've transitioned the program to full direct home delivery. Given the size of the air purifier, as you can see here, and people's busy schedules, this approach provides a convenient delivery option for interested residents. Next slide, please. So talking a little bit about school purifiers. We have heard from school districts with campuses in the Tijuana River Valley area that a desire for air purifiers in their classrooms to help address air quality impacts from the cross-border wastewater crisis. As part of our annual Clean Air for All incentive solicitation, we did receive applications from 2 school districts and 1 charter school in South Bay for funding to purchase air purifiers for use at their schools. We're working with these school districts to gather the information needed to complete the evaluation process and anticipate funding approval for those in the coming weeks. Although our monitoring data indicates that H2S odors tend to peak during the evening hours, children attending schools and daycare centers within the most impacted communities could also benefit from purifiers in classrooms, as odors can linger in the early morning hours and children spend several hours per school day in the classroom. APCD recently sought federal funding from the EPA for a classroom air purifier program, but unfortunately our request was denied. And we see a potential opportunity to utilize any of the remaining 617 funds available after the distribution of 10,000 household purifiers planned for the IRA program towards projects to purchase air purifiers for additional public schools in the Tijuana River Valley, as well as daycare facilities within the eligible area. Coordination with the California Air Resources Board and the AB 617 community may be needed to redirect IRA funding in this manner. And so, we're happy to have those conversations with them if the board so pleases. And just to wrap up, our recommended action for today is for the Air Pollution Control Officer, I'm sorry, next slide, for the Air Pollution Control Officer to explore options for utilizing the remaining unspent appropriations for the IRA program to purchase air purifiers for public schools and daycare centers within the program area. So that concludes my presentation for today, and we're happy to answer any questions you may have.
Thank you, Mike. Clark, is there any members of the public that have registered to speak?
Thank you, Chair Bush. We have 1 member of the public requesting to speak on this item. We have virtual caller Truth. You have 3 minutes to address the board. Please begin by stating your name for the record and use the timer that is on the screen to self-regulate your time.
Hey, thanks. It's Truth. Can you imagine if I didn't call in, you would have no commenters on this very important item? Affects how many tens of thousands of people? I'm going to say thanks for the time chart. The air purifiers were given out right before I got a really bad cough that took about a month to heal from. Or sorry, after I got the really bad cough. And I say that with the 26,000 plus residents of Imperial Beach in mind, including my friends who do not have the ability to stay and wait and heal like I did. Because 5,500 air purifiers does not cover even half of the population of but 1 area affected. I remember at that same time, Nora Vanishing Vargas say every city should contribute money for purifiers. She said that at Sandac. Because obviously the county's $8.6 billion budget was small. The states too, of course, Biden. I was against cities covering the failed county, state, and feds. $2.7 million in air purifiers purchased via interest from AB 617 tells me they never program money specifically for any solutions to the sewage. How much of this money has been spent? How much is still languishing there, ready for someone to program it somewhere else? And I ask, when these children go play outside or when they leave school, that means they get to breathe Mexico's toxic sewage again, right? How many doors are reached by APCD? Because I've told a story here about a friend who had a purifier pickup canceled on them. APCD suddenly said they'll deliver it instead. And I asked, why couldn't they have just delivered it to begin with? Would have made life really easy. I now have another friend who I helped sign up for an air purifier last month, and yet they haven't heard anything back. How is APCD ever going to help children when they can't even help adults get a purifier? There was an APCD purifier in San Isidro for sale, only $300 on Facebook Marketplace. Not surprised it was not a purifier located in IB, but maybe there needs to be a contract or something that says you can't sell it, or maybe people have a right to sell it if it's not actually working. Because you need a purifier in each room of each house for actual efficacy, because otherwise you have walls blocking the purification process. It just doesn't make any sense, scientifically speaking. What is APCD's plan for the people selling the air purifiers online? Why did Biden deny federal funding for purifiers for children? Why did he do that to his fellow Democrats? Why are they suffering TDS when Trump's EPA is at least saying they're going to respond? I mean, wow, it's a miracle. Why not install HVAC instead of purifiers? Why haven't the schools done this themselves? Why not attack why the hydrogen sulfide emissions are spiking at night when people in America are sleeping? Why is Mexico still awake? Don't waste our tax dollars on toxic EVs and chargers. That's not a solution either. And if CARB can afford pilot projects giving out gift cards or discrete monetary incentives to people in Mexico to convince them not to burn tires, that means they can definitely afford more air purifiers. So there's a lot that could be said about this program. Thanks.
Thank you, Truth.
Thank you. That concludes public testimony on this item.
All right, with that, we're going to move on to board comments. And I have first Member Aguirre.
Thank you, Chair. I have a lot to say about this, so I ask my colleagues to bear with me. Thank you for the presentation. I believe that there are several expansions to the AIR program that I would like to discuss. We can no longer delay action, and it's very clear that families are suffering, they're in pain, they're experiencing illnesses and reporting impacts on their quality of life. Yes, we know that hydrogen sulfide is present and potentially in these schoolrooms and daycares, but what else is that we're not measuring for? So I cannot emphasize enough that we need to distribute these filters and expand the program even further immediately. So we already just heard the ACE survey results. I'm not going to revisit those, but one point that I'd like to also highlight that wasn't discussed is the 70% of people reporting disruptions in their household, including exercise, social activity, sleep schedule, can have unintended repercussions in their quality of life. So I think that's incredibly important. These are foundational aspects to a healthy life that are being impacted by this crisis. So we cannot wait any longer. We have to do better for the entirety of the people of Imperial Beach and South San Diego and San Isidro and West Otay Mesa and all of the affected areas, including Nestor. So I would like to suggest that we either include these recommendations that I will list in this item today, or that we bring it back at the chair's request for a special meeting. And these are my recommendations. One is to establish a standard of 1 air purifier per room instead of 1 air purifier per household. We know that one household can have many different family members, up to 5, 6, 7, we don't know, but 1 air filter is not enough. Second, no longer require proof of address as part of the application process for the AIR program. That, I believe, and many of the people that we've spoken to see it as a barrier. especially in the times of this administration's ICE raids. People are very hesitant to share their information. We need to also streamline the process and make it as simple as possible. Many residents, especially seniors, are unable to access computers or websites, so they don't know. I personally met many of them during the campaign as I was canvassing and talking to people. 3, direct our staff to purchase all remaining air purifiers and filters in the next 60 days so that these air filters can be distributed immediately locally. We know that when you order an air filter, it could take up to 4 to 6 weeks for it to arrive directly from the supplier. We need to make sure that we get these air filters to people immediately, as fast as possible. So we could do that by partnering with local community groups, getting volunteers to go door to door to make sure not one person falls through the cracks and doesn't get an air filter. 4, direct staff to work with elected offices, community-based organizations, and as I mentioned, going door to door. I think that we have an opportunity to replicate the work that's already been done by the CASPER study, by the ACE study, by Dr. Granados' team, who've been embedded in community, who've been talking to people who know, the community knows and trusts. I think that's something that we could use to help distribute the air filters in a much faster way. 5, return to this board during the December meeting with options to establish an ongoing air program and a program plan that includes but is not limited to an economic analysis on what it would cost us to hire more people so that we could have more staff dedicated to this program and have it be beyond a pilot program. How air purifier distribution will be expedited to meet 100% distribution goal by the end of December. Expand the program to include all of the remaining schools and daycares, which we're already considering today. Expand the program to include the recommended number of air purifiers needed per individual household. Increase the community engagement. As I mentioned, work with local volunteers and community-based organizations. 6, direct staff to pursue state, federal, and other sources of funding so that we can keep this program going. At least from my end at the county, I will make sure that from the county, we do everything that's possible to ensure that we have another revenue of funding to help support this program. And last couple of points here that I'd like to make is I recommend that staff comes back to us at the October 9th meeting with a report on the feasibility of expanding H2S monitoring in the Tijuana River Valley, including engaging the community and other industry and scientific experts on where additional monitors are needed. We know that we have limitations on the sensors that are out there that we own. We know that that is not enough. And lastly, I'd like to request that staff return to the October meeting with potential analysis and actions necessary to allocate our existing resources to conduct air monitoring at Saturn Boulevard at the hotspot, which we currently do not have. The only people doing that are the academic institutions, which is great, and we're very, very grateful and thankful for their work, but this is the responsibility and mandate of this agency. Thank you.
Thank you, Member Aguirre. With that, I'm going to turn it back to staff to chime in. So we have about 8 items here, and I don't know if council needs to weigh in on what we can take action of these 8 items as a board through a discussion now, what may need to come back. So, and Paul, I don't know if you wanted to go kind of point by point on these items, because generally for me, and Member Aguirre did present them to me earlier today. So I, generally agree with all this. And I think it's what we need to discuss as a board is hear from staff. What is your capacity? What's doable? What are the gaps? And then where can we find out what the gaps are? So what can we handle, and what do we feel comfortable, directing you all now? And what do you need more information on to where you need to come back?
If we want to start with the council's answer, yes, I believe all of the 8 fit neatly within the way that the item was agendized under the Brown Act. And because so many of them are simply directing staff to return with information, we don't have a Brown Act problem.
Great. Thank you. Okay. So Paul and Mike, how, I mean, do we want to start on these recommendations, one by one with, or how do you all want to kind of go through this?
Yeah, if I could just start and then Mike can talk about the specific requirements or specific suggestions here. I do think we're going to need some time to evaluate these. We absolutely recognize the crisis that's still going on in the Tijuana River Valley and the need for these suggestions. And absolutely are open to doing what we can to get purifiers out as quickly as possible into the hands of residents. I think we're going to need time to be able to give this board context in terms of what it would cost, what resources we would need to pull from, what staffing resources, and so that the board can weigh what that total program looks like, and also have that in the context of the discussions that are going on at the county about additional resources the county may be able to bring to bear, the additional resources that we're currently, we're in meetings with the county several times a week on coordination on some of these. I think some of the ones related to the immediate one related to air monitoring at Saturn Boulevard. We do have a meeting tomorrow morning with the county about that. I think we'll be able to direct some resources. We definitely will be able to direct the resources we have, but we do need some additional approval from the contractor that we'll be able to get access to power at the site. That's the current lack. But we have a meeting first thing in the morning to discuss that.
Sorry, which item was that? Number 8?
Number
Okay,
8.
got it.
So that one is more of an immediate within the next 30 days. So I can give you an answer right now that that's something that we're already working on. With the others, I'll let Mike respond to some of the other ones in a more detailed fashion. But just as a whole, we're going to need to report back after doing some investigation as to what the total costs would be, so we can give you full information.
Great. And it sounds like even just from that answer that there's items that we can direct you all to pursue all of these. And then some of these you guys are already working on so that you can come back, right, in September if
So
needed.
I guess the way I would couch it is direct us to investigate these.
Got it.
Because I don't think that we could commit today to a program that we run that has one purifier per room without knowing where the resources from that are going to come from. So what I'd like to do is be able to report back on all of those, again, what those costs look like, what other partners might be able to contribute to that, and so that the board has full information to have that discussion.
Great. I appreciate that. Vice Chair Berber Garcia, and then I'll let Mike go into some of these details on these items.
Oh, I wanted to make a motion to direct our APCD staff and our APCO to investigate the recommendations by Member Aguirre and get back to us at our next board meeting.
I'll second that. Yes, Member Aguirre.
So sorry. Can I suggest a friendly amendment?
Sure.
Just to, instead of the next meeting, to call a special meeting that could be done sooner?
Yes.
Would you consider that?
Yeah, I'm okay with that amendment. I'd make a motion to direct the staff and APCO to investigate these 8 recommendations by Member Aguirre and to present it back to the governing board at a special meeting
In September.
in September.
And with that, yes, and I'll second that friendly amendment. I'm okay with that. So Mike?
Yeah, sure. I can give a little bit of preliminary information on some of these suggestions currently. The first item, as Paula mentioned, regarding one air purifier per room versus per household. There's a couple things we need to look at there. One being, the rationale behind that was to try to reach as many households as possible, right? And so I completely understand the dynamics of obviously multiple people living in the household, but given the limited funding we had, that's part of the dynamic the dynamic there. We're also in conversations with CARB, who is the funding source for these, to make sure that complies with their program requirements. The AB 617 dollars that were used for this program, there are specific, regulations and requirements from the funding agency that we need to make sure we meet. And there's something specifically in the guidelines that talks about a single application per residential unit for the air purifier program. So we want to touch base with them to see, if we were to look at options for expanding that to more than one per household, does that run afoul of their requirements? And as Paula alluded to, just looking at the magnitude of what that might be and what the dollar amounts may be for something of that scope is going to take a little bit more time. On the second item regarding proof of address, we have certainly heard some of those same concerns, and I think they were exacerbated in the recent months with some of the immigration issues that we've been seeing. Anita on our team has been doing an outstanding job in trying to work with the community to overcome some of those where we can. One of the things we've implemented already, as I mentioned in our presentation, is these in-person verification events where we don't have to have people submit things online, where we can just, staff is right there looking at it and checking it off. Similarly, there are some requirements in the state guidelines for this funding that require us to at least collect the address information. So I don't know that we can not collect that, but there may be some flexibility in, the process for doing that address verification. And again, part of the intent there was to ensure that, these units were being distributed to those most in need within the community and also meet the geographic requirements of the program. And so that's something that we'll have to look at, but we certainly have seen that as a barrier and things that we're trying to work to overcome with the team. Regarding number 3, purchase remaining air purifiers and filters within 60 days. That is something that we have at least mentioned with the vendor. They've got some supply they have on hand. I don't know that they have the whole 4,500 kind of that we estimate could be purchased with this funding, but we can have conversations with them about what they do have available. They have had some impacts with production lines associated with the recent tariff issues. And so there's been some delays in some of their production, but they do have a certain number on hand. And so we want to talk to them about what they are able to provide to us sooner rather than later. And then the second part of that is equally challenging, I think, trying to identify locations to store whatever volume they're able to provide. There's certainly logistical challenges associated with that, as well as, once we have them, what does distribution look like? So that will take a little bit of effort. I will say that Anita, again, on our outstanding team, has had some preliminary conversations with staff at City of Imperial Beach, and they've offered up some warehouse space to temporarily store some of these things. Certainly not 4,500 units worth, but we can look at other opportunities that may exist like that around the county.
On that, so what is their standard time for delivery? Because we're hearing that it's taken 4 to 6 weeks. So what is their stated time to us?
It'll range from 4 to 6 weeks from the time like an application is submitted to potentially when they receive that. Some of that is, there's some processing time on our end to evaluate those applications. Typically, once we place an order with the vendor, and Anita and Eric chime in if I got this wrong, it's about a 2 to 3 week lead time from that point for them to do their processing, ship it across. Their facility is on the East Coast, ship it across, and then they use they're partnered with FedEx, and there's some logistics associated with FedEx to get them out the door. So, on the longer end, it could be 6 weeks, hopefully closer to 4 weeks on the shorter end. As the commenter alluded to, there's always special circumstances, sometimes where things don't always work out well, and we're trying to address those, as they come up with the team. So unfortunately, some folks are waiting longer than that, but we're trying to minimize that to the extent that we can. Excuse me.
No worries.
On number 4,
Yes, the expanded outreach.
yeah, certainly. As we alluded to earlier with Dr. T and his team, having some of those conversations already with community partners to help us with that. Anita, again, I keep saying her name because she's been an outstanding advocate for this program, has a lot of feelers out and had a lot of conversations with CBOs and various other governmental organizations to help us with this. Even our own internal Office of Environmental Justice team, shout out to those folks, have done some of this door-to-door outreach themselves. We've looked at, on the map that I shared earlier, you could see kind of the distribution of the location where the filters have gone. We tried to look at that map and identify areas where we saw gaps and have our team kind of do some door-to-door work in these areas to bring up additional applications there. So yes, certainly open to having those conversations and seeking out that support where we can. One of the things that we'll have to
And that
think about.
sounds like something immediate that can be done, like
It's some
done
to a
now.
certain extent it's already happening.
Okay,
Right. But
great.
I think we can continue to expand on and elaborate on those. One of the things that we have heard there, which is a fair response from some of the CBOs in particular, is, there's an effort and a lift on their side, right? And so there's potentially resource needs and maybe a need for us to look at ways to try to compensate them for their time spent on helping us out with this. So we'll have to look at that a little bit as well. But I certainly think that there's probably a decent amount of volunteer work that we could get support with as well. Number 5, there's a lot there. And so I definitely think that's one that will take us a little bit of time to review and see, if there's a desire to expand this program to the scale that we've talked about, that's going to require a significant amount of funding and trying to figure out what that might look like.
The scale being, if we expand this standard to 1 per room, and if we're looking at all, is it 35,000 people or households?
Households is kind of what I've heard. And
Okay.
so, if just roughly, if you're talking about 4 per household, right, on average, that's a pretty significant number of filters. So we'll need to kind of identify what those costs look like and what we think we may be able to do probably in chunks, realistically, if we can accomplish that. And then certainly number 6, I think even in our action back in November, we did request authority from this board to pursue and accept any funding from state, federal, local sources to help support this program, which is, appreciative of some of the work from Member Lawson Reamer's staff to help get support from the city of Solana Beach. You saw that contribution we got from them. That allowed us to go out and submit this request for supplemental environmental project funding from CARB and that $130,000 that I referenced that we got recently. And so we certainly can and will continue to pursue as many grant sources, funding sources as we can.
Great. And then number 7, the expand monitoring, that you report back in October on that, right? The number
Sure.
7?
Yeah, I'll take that one. We can definitely report back on that. As I mentioned, for number 8, we're already working on that and meeting with the county on that tomorrow morning. But for number 7, we'll report back on that in October.
Got it. So as I understand it here, and then I'll turn it over to the board members for comments. I know we have a motion and a second on the floor. So I see the areas that staff is already working on. There's 3, and that's the expanded outreach, number 4. Number 6, the pursuit of more funding that's been ongoing, and there's some additional suggestions there. And then number 8, the Saturn hotspots. Was that fair to say, like, this is something that is actionable after we get this item approved, right?
Yeah,
Yep,
many
that's
of those
fair.
things are
And the
happening
other-
already, yes.
Okay, and then the other 5 items are something that staff can report back on in the next month?
If I could clarify.
Yes, please.
I think in number 5, for example, Mike referenced the original suggested report back date on that is the 11th of December. I think we'll at least be able to give some initial indications to this board in
Thank you.
September, but I think for a lot of that, we may need additional time. So just wanted to clarify that.
Thank you. And just from my vantage point, I do like and support the standard of 1 per room, but I want to be clear for me, my expectation is not for APCD to take on everything, right? So in terms of the funding for this, I don't expect us to all, go by ourselves to do that. I think this is a shared effort that should have the cooperation, the resources from the county, from the federal government, from cities, from different agencies. And I don't know if staff could explore what like a pro rata share of that from our regional jurisdictions. Like I'm open to what that looks like. So in how I was looking at the standard that if we have a standard of 1 per room, we're not legally responsible for covering all of that straight out the gate. That's just a goal, a standard that we should push ourselves to and get to. But that's a mechanism to really push other agencies for more funding. So that's how I saw it. So I don't know if staff or any of my colleagues had thoughts on, or Member Aguirre, if you had thoughts on that.
Thank you. No, I think that's a fair request. And just coming back to, what's been discussed in the past, the ball is in our state governor's court and our current president's court. We need to make sure, I understand the concerns regarding resources and the limited resources this agency has and other agencies. And I'm so incredibly grateful to the cities that contributed at our highest time of need when they did, like Solana Beach and others. But it shouldn't be up to these cities. Every single jurisdiction in the affected area has declared a state of emergency. And I know some critics, like callers, tend to say, well, we don't need one. No, we absolutely do, because a state of emergency is when a natural or man-made disaster is causing our jurisdictions exceeds our capacity to address the emergency and the needs and the effects and the consequences and the danger that our residents and constituents are being put in. This could not be a clear definition of that. So I think as we analyze the costs, the true costs, because 40,000 or so households are the ones we know are reporting being in need. We only have 10,000 filters. That's not nearly enough. And now we're talking about one per room so that we could truly purify the air and protect people from who knows what else they are breathing in. I think it sends a very clear message that we cannot take on this burden, moral, ethical, financial alone. Thank you.
Thank you. And then I see Member Campbell, then Member Gloria, and Member Koval. Member Campbell?
Thank you. I just wanted to remind us that we were told each one of these items, these air purifiers, and they seem to be very good from the description in detail of what they do. Scientifically, I think they're very good. 1,700 square feet are covered by each one. And if you just leave the door open between the rooms, the air flows throughout the house. So I think we need maybe one more than one per household, but not necessarily one in every room. So I think, we don't necessarily have to think of one in every room, but just what is necessary. The average Claremont house originally built was 1,100 square feet. So even one would have taken care of a Claremont house. So I'm not sure the size of the houses in the area where we need these, but I do recommend that we have them for everybody, every household, and every place where children are taken care of, but not necessarily that many per room. So I'm not sure how to amend that. That would say the amount necessary for good coverage, because even a smaller space, we might need more than one.
So Member Campbell, I think we were talking about was exploring that and looking at that. So still coming back with a response, because as staff also shared with us that it's also about getting to as many as households as possible. So I think at this point, when there's such a shortage, we wouldn't want 3 to 1 household when there's so many that don't have them at all. So I definitely hear you and agree with that part. So I think we're looking at exploring that for October.
Yeah, we have to take that into account, all the mentions. Thank you.
Great. Thank you, Member Campbell. Member Gloria?
Thank you, Mr. Chairman. And thank you to staff for the presentation and Member Aguirre for her recommendations. I wanted to start just simply by expressing appreciation to APCD boards, or APCD staff. We talked about some of the history or recent history on this particular issue. And when this was brought at that really terrible meeting in Kearney Mesa, where I don't think the air conditioning or the microphone system was working that day, Paul, you and your team immediately said, we'll do whatever we can to help. And this report was extremely helpful to understand none of us individually could get 5,000 of these things out to the community. Now, that's far short of what we would like, but I would dare anyone else to try. And I don't see anyone else trying. So I just want to express that appreciation of this, folks. This is nothing that we've done before as an organization. And in a very, very short amount of time, you all got something in place and started going, can it get better? Well, I've heard you said that you think it can, and you've been continually looking for ways to improve. And so I just want the record to reflect and be very clear that our team, I think, is meeting the moment that this board demanded of staff and have worked very creatively to get solutions out the door. Now, I think Supervisor Aguirre is providing some suggestions and direction on how we can maybe be more impactful. I'd be interested to know more about all of that. So I'm supportive of the motion today. I want to temper expectations, though, of the entire group in terms of limitations of staff resources, both time and money. the willingness or lack thereof of partnership from other jurisdictions for whom we should be seeking assistance. But I have no problem with us asking the questions, in part because I don't hear a lot of other folks asking the questions. And if it's not us, then who? So again, tremendous kudos to this team for doing what you've done to date. What I heard in the staff report is that about half of these have been expended. We have about another half we can go under our current circumstances. Member Aguirre is asking us to raise the bar higher, and I think that's exactly the right thing to be asking for. I'm just hopeful that we'll have willing partners to allow us to do that. And so if in a few months' time, or a few weeks or a few months, depending on how long it takes, I think that also needs to be some flexibility. If we can find a way to get marginal improvement, I know that will accrue to the benefit of our shared constituents in Imperial Beach, Otay Mesa, Nestor, Edgar Highlands, et cetera. And I'd be all about that. Lastly, I would just say I would, as we consider these resources, as finite as they are, this is addressing symptoms. I want us never to lose sight from the actual source causes and the fact that we still have a lot more to go with regard to the funding necessary to solve that issue. But I will tell you, Member Gary, are we on week 3 or 4 at this point? The laser focus you've brought to this issue in a relatively short amount of time is only adding to the work that you did as mayor. And I'm excited about what we're doing on Saturn Boulevard, in the Otay Mesa Valley. I'm sorry, in the park. I'm forgetting the park's name. The county park. The Navy property. Let's just say that much. The Navy property, which there's some deep pockets there, to try and address some more of this. And we will continue to do what we can, but supportive of the motion, appreciate the demand to go higher, appreciate staff's always receptivity, but I want to encourage everyone to be somewhat practical in what we can possibly accomplish. But this board should demand more. We did it before. This team met that expectation. I think raising the bar, I suspect we'll get more. It sounds like you already want to do more, but let's make sure that we're inviting the participation of other folks. And I was disappointed to hear about the federal denial, largely because this is an international boundary issue for which they have the primary responsibility. But we can keep asking. Worst they can do is tell us no, right? But again, appreciation to all involved. And I belabor the point. Thank you to staff for being as responsive. I can't think of another example in my career in public service where something was never done before that is now being done and has been done in a way that I can be very proud of. So kudos to you and your team, Paula.
Thank you, Member Gloria. And Member Koval?
Those are great comments, Member Gloria. Yeah, I have an air purifier at my home in Santee for a different reason. I live next to the San Diego River, and so there's fires and other issues. So when I purchased one, I don't have a big home. It covers 1,100 square feet, and if that's the air purifier, that's pretty big compared to what I have. So my question I wrote down is how many square feet do they cover? So thank you, Member Campbell, for pointing out at 1,700 square feet. It might be overkill to have one per room when we have houses that don't have any. So I really do think that we should really focus on getting them to as many homes as possible. If there's a bigger home that needs to, then address that. But I think that should be the goal, as many homes as possible.
Thank you, Member Koval. I agree. Vice Chair. Oh, you did. Oh, okay. Member Granados.
Yeah, thank you. I agree. Those are really good comments, and I appreciate especially all the work that you all have done. And Paul and I have had some long conversations about how to make things better. And I would say, as we're just discussing, let's lean on our community partners as well. I know there's so many of them out there that are willing and able and ready to help. And so let's not hesitate to call that in. A lot of people do want to provide space and support and help their constituents as well. And I also agree with, priority is getting everybody at least one, but also having been in the houses now that have one, and some of, I don't know if you all, I live in Spring Valley, my house is a bit cobbled together. And so although I only have 1,700 square feet, I have a weird addition on the top. I have rooms that don't connect. It's very odd the way people add on to their homes in San Diego. So I just want to say that sometimes although it says it covers, this amount of feet, doesn't necessarily mean it's getting to grandma's room in the back. And so asking grandma to sleep on the couch may not be an option. So I think we should definitely consider the fact that in San Diego, we have some interesting properties, the way that our houses are laid out, and that some may definitely require one. I agree with you. These things are huge. I think I could definitely use 2 in my house, again, only being 1,700 square feet, but That being said, I think it's a priority to get everybody at least one to start and then see how effective that is. I have been in a home with one running at full speed and it still wasn't 100% effective, obviously. So I also just wanted to add, I think the education that goes along with this, it's very important for us to remember to tell people this doesn't fix it. It doesn't even stop it, but it helps clear the air sooner than it would if there was nothing at all. And so I've heard a lot of people say it doesn't work, it still stinks. And I'm like, but did it stink for as long as it did before? And so I think also making sure that that educational information is out there, that this is, sort of a Band-Aid, but we're doing what we can. So those are just kind of my thoughts.
Thank you. Member Cole?
If a household has two, do they need to be that size? I mean, could we consider a big one and a smaller one if that's what's needed?
Potentially, as Member Stigliano said, each household is going to be different, right? And so whether it's the layout of the household, the number of people that live in there, how their HVAC functions, doors open, doors close. I mean, there's a million different factors that could, affect how well these things work at any square footage, right? And so I think it is a little bit of a difficult dynamic to try to identify what's going to work in any individual home. But as has been said here, and as we've talked about, I think the initial idea with one per household was trying to make sure we reach as many households as possible. In addition to that, we've got to do a little bit of work with CARB to make sure that their funding allows for multiple units.
Member Aguirre?
Thank you. I think that we need to make decisions based on science and not based on what available funding we have for now. I think that when you bring back that feasibility analysis, we'll get a better understanding and idea of what the funding, the cost will be to put one per room. But recommendations from our public health services say that we should include one per room until adequate evidence shows otherwise. So to compare Santee to Tijuana or Valley is apples to oranges, no offense, but we have an insurmountable amount of bacteria, viruses, parasites, heavy metals, chemicals, volatile organic compounds, volatile inorganic compounds, plasticizers, herbiciders, in addition to an array of toxic gases, including hydrogen sulfide. And we need to be very conscious of the fact that we're talking about compounding effects of people that have been chronically exposed for years, that have already been suffering ongoing chronic illnesses, including walking pneumonia, migraines, allergies, and we're talking about the most vulnerable in our communities, children, the immunocompromised, and the elderly. So I would pose this question: if we live, I know I do live there, and I wake up every day and I have to, as soon as I open my door, take that big whiff of not a smell of what is hydrogen sulfide, which is a toxic gas that does have long-term health effects. I just want to put things into perspective. This is what we're thinking. This is what we're talking about when we're talking about, if it's financially viable to buy enough filters or not for the people that are suffering right now in this district.
Thank you, Member Aguirre. And then question to staff, a couple last items. So on number 3, the purchase of all remaining air pure filters and that, is there an opportunity for you all to look at how the timeline can be shortened from the 4 to 6 weeks? Again, I'm not looking for an absolute commitment, but at least an opportunity, if you guys can explore that.
I think there's opportunities for us to look at the frequency of the orders that we place and potentially, maybe smaller batches coming out more frequently, at least initially, in addition to having conversations with the manufacturer on, hey, what do you have available sitting in your, warehouse now that you could send to us in one bulk order, if we could find the place to store it and figure out how to distribute it.
Okay, and then my final question, then I'll move on to Vice Chair Brett Garcia, and then we'll go on to vote. The EPA funding, so it was, our request for funding was denied, and what was the clarity on when that was denied and what the reason was?
We submitted that. Typically with EPA, we have ongoing funding through the Section 105 program that supports kind of some of our base operations. They will often say, hey, if we have additional funding available, do you want to submit an application for various programs? So as part of that proposal, we submitted an application. I think the request was somewhere around $900,000 because we were looking at schools specifically. And that was in February. I
Of this
need
year.
to check.
Okay.
It was recently.
Okay, so with this new administration though,
Correct.
the new EPA, okay.
Correct.
Yeah. And they did not give a reason why it was denied?
What we were told was that budgets for those programs were being slashed. So these are some of the same conversations we've had about Section 103, 105 funding, that they didn't have as much. Originally, they had said we would get a portion of those funds. I believe it was $330,000. And then they came back and said they would not be able to fund that because the region was not allocated those dollars from the federal government.
Got it. Okay.
Region EPA Region 9 is.
Got it. Well, hopefully there's still opportunities with the new EPA administrators still, and some of the relationships our board has to still push that. So
Agreed. We can certainly reapproach them, and especially, generally EPA has jurisdiction over indoor air quality. So it is certainly something that we can also, push back, and given the critical nature of what we're talking about, I think we can certainly reapproach them.
great, thank you. Vice Chair Garcia, we'll go ahead and call the vote.
Sorry, it's just something that I thought about right now. We're having the air filters directly delivered to homes. Is there any way that we're ensuring that they're being set up right and the families know when they're supposed to change the filters?
We do have some educational materials to try to provide information on that. We're not there setting them up, obviously. There's resources available from the manufacturer themselves that describe how to change the filters and things of that nature, but we do provide some educational flyers and resources to explain. And again, it's difficult because circumstances regarding how frequently you need to change them are going to vary from household to household. So, what we've heard is, anywhere from 8 to 12 months. But again, could vary depending on, what else, if you have pet dander in the household, and the numerous factors that could change that. But the short answer is we've provided some educational materials for folks on how to appropriately use them.
And they're pamphlets, not videos?
It's a combination. We have a flyer that describes how to use it, and then there's some manufacturer videos that we provide links to that show them how to change the filter and things of that nature.
Thank you.
All right, with that, we'll go ahead and call a vote. We have a motion and a second on floor, and we'll do a voice vote. All those in favor of the motion to support Member Aguirre's 8 recommendations with a friendly amendment, all those please signify by, yes, there's comment.
I just wanted to clarify, staff had recommended an action to allow us some flexibility in the meantime to be able to provide classroom air filters. Happy to defer that until we have this larger discussion about the residential purifier program, but I just wanted to clarify as part of the motion.
Well, from my intent wasn't to delay that part, so would this get in the way of the classroom part?
No, we could certainly proceed if the board wishes to give us authority to allow us to use any excess funds we have right now for classrooms and daycares. We could certainly proceed with that and still report back on everything else in September. I just wanted to clarify that point.
I think we're good with that. So I mean, I can make a amendment to that motion to add, to give staff the authority to include in that current purchase the schools and daycares. So yeah, I can amend it. Okay. With that, we'll just take a voice vote. So everyone in favor of the motion on the floor, please signify by saying aye.
Aye.
Any opposed? Abstentions?
Thank you. With members Fitzgerald, Gomez, and Lawson Reamer absent, that motion passes with those board members who are present voting aye.
All right, thank you everyone for the robust discussion. Now we're moving on to item D3. So that is the notice public hearing. It's the continuation from our previous meeting, adoption of new rules 67.26, commercial charbroiling operations, and corresponding amendments to rules 11, 12, and 40. Clerk, can you please provide the public testimony instructions, and then we'll have the staff presentation by Supervising Air Resource Specialist Nick Cormier.
Thank you, Chair Bush. Per the Governing Board Administrative Code, the submission period is closed for requests to speak on this item. All public testimony will be heard at the conclusion of the staff presentation.
All right, thank you, Chair Bush, and good afternoon, board members. This item requests governing board approval for a proposed new rule to implement readily available technology that has been in use in several counties around California for decades, which can result in quickly achieving significant particulate matter emission reductions from commercial charbroiling operations and meaningful public health benefits. This proposal was previously brought before the board for consideration in April, and at that time, the board directed staff to conduct additional outreach to affected restaurants and evaluate the potential for a phased-in implementation approach, which staff will discuss as part of today's presentation. I'll now turn it over to Air Quality Engineer Miriam Sanchez, who will provide the more details on the proposal. Miriam?
Thank you, Nick, and good afternoon, members of the board. Today, I will be presenting new Rule 67.26, Commercial Charbroiling Operations, and corresponding Rules 11, 12, and 40. Next slide, please. We'll be covering the following topics during today's presentation. First, we'll start off with explaining what charbroiling operations are and why the proposed new rule is needed in a region. We'll then discuss the governing board's direction from our first meeting back in April, and we'll go into detail about enhanced engagement and outreach we conducted with potentially affected facilities. Excuse me. Next, we'll go over the list of facilities we believe might be affected by the proposed new rule, the estimated emissions, and the estimated emissions reductions and health benefits from these predictions. And finally, we'll conclude with staff's recommendations. Before we begin, though, I would like to clarify that when we refer to a chain-driven charbroiler, we're talking about the mechanism of the actual device and not whether the restaurant is an actual chain restaurant or not. Next slide, please. So what are charbroiling operations? The picture on the left is from a San Diego restaurant that is well known to operate chain-driven charbroilers. As you can see, uncontrolled particulate matter, or PM, is emitted, creating smoke, which drifts into an apartment complex nearby. This is an air quality problem that is common and found throughout the county, including in our under-resourced communities. Emissions from charbroiling operations contribute to about 13% of these total PM 2.5 emissions in our county, which makes it one of the largest sources of PM 2.5 emissions under our jurisdiction. Chain-driven charbroilers specifically use conveyor belts that they automatically carry the raw meat through flames, which we'll show you on the next slide. They're commonly found at fast food restaurants to allow for high-volume cooking and quick service. Proposed new rule would only target restaurants that operate chain-driven charbroilers, which represent a small number of food establishments countywide. Next slide, please. The videos on this slide illustrate how a chain-driven charbroiler operates. As you can see, the device is intended to cook a high volume of meat in a short period of time, making it a critical device at fast food establishments that mainly cook hamburgers to create that charred, smoky flavor. During this process, fat from the meat drips into the flames, which creates the smoke and emits particulate matter and VOCs, which contribute to your PM 2.5 and ozone pollution. Notably, these devices are not typically found at pizza places, sandwich shops, or ethnic food restaurants. Next slide, please. To clear up any misunderstandings from previous testimony, it's important to understand what a chain-driven is and what is not. And most importantly, like I mentioned, what's not going to be covered by subject to proposed new rule. The equipment shown on the slide would not be subject to proposed new rule. This includes the under-fire charbroilers, which are similar to the barbecue grills at home. It also includes flat top grills, griddles, toasters, and all types of ovens. In short, if a piece of equipment doesn't fit the definition of a chain-driven charbroiler, it will simply not be subject to proposed new rule. Next slide, please. Previous air quality plans supported by staff, the public, and the governing board have aimed to reduce charbroiling emissions for both regional and community level air quality improvements. Specifically, the 2022 Regional Air Quality Strategy, Measure S6, identify a charbroiling rule as a way to reduce ozone-forming VOCs. Additionally, the 2021 Portside SERP, Action C3 specifically, it focused on reducing PM emissions from restaurant operations. Furthermore, the region has now a greater need to reduce PM emissions to meet the stricter new EPA health standard for fine particulate matter PM 2.5, which was set last year, and it lowered the standard from 9 to 12 micrograms per cubic meter. Proposed new rule would support these efforts and improve air quality and public health. Next slide, please. If adopted today, proposed new rule 67.26 would apply to owners of new and existing facilities that operate change-driven charbroilers at commercial facilities. The proposed thresholds and requirements in the new rule are very similar to those found in existing regulations that have been in place for almost 3 decades in regions within our state with large populations such as Los Angeles, Orange County, Ventura, San Joaquin, and the Bay Area. As a result, emission control technology for change-driven charbroilers, specifically the catalytic oxidizers, is highly developed control technology that's easy to acquire and affordable equipment to owners. This has led to a well-developed and affordable market for emission control technologies that equipment owners of change-driven charbroilers can easily access. Next slide, please. We anticipate that most owners will choose a catalytic oxidizers, like the one shown on this slide, to control emissions of PM 2.5 and VOCs. This simple control device simply sits directly on top of a chain-driven charbroiler. It installs pretty easily and has a snap-on filter that it easily removes to clean it. It's typically not required to do any structural changes in the restaurant to install this. And it's also very, it's been proven to reduce pollution from these type of equipment at a very minimal cost. Next slide, please. At the governing board meeting back in April, the district staff, we presented technical details of proposed new rule. The language that was included in the rule, it has not been significantly revised since that meeting, and only administrative and technical minor edits have been made since then for clarity purposes. At the April meeting, we received direction to work with the governing board chair and vice president to conduct enhanced public engagement and outreach to businesses that could be affected by new rule. We were also directed to consider a phase-in strategy for small businesses and then return to the board at a future meeting. For the next few slides, we will summarize staff's enhanced outreach efforts that we did since April and the levels of public and industry engagement we've seen and how this information has better informed us for our proposal today. Next slide, please. We focused this enhanced outreach around a simple and easy to read personalized bilingual letter, which was sent to approximately 200 facilities, and it was sent by certified mail. The letter included important information such as what requirement is and is not being affected. It provided how to provide feedback, a QR code to engage with us more easily, and it also included a potential timeline for board consideration. We received confirmation from about 92% of these restaurants that were notified. We confirmed that they actually received the letter either through confirmation from signatures from the certified letter or through regional representation. The remaining of the 8% of these restaurants were then contacted through focused efforts, including in-person visits and phone calls, particularly focusing on the small and independent businesses. This enhanced outreach confirm that almost all of these and all of these small independent businesses actually do not operate this type of equipment, a chain-driven charbroiler. So they will not be subject to proposed new rule. Next slide, please. We also attempted to reach restaurants through noticing of applicable AB 617 steering committee meetings within our APCD July newsletter and through the publication of the public notice for this board meeting in the San Diego Union Tribune newspaper for a 30-day period. This public notice was emailed specifically to approximately 12,000 recipients, and 29% of those 12,000 actually opened the email. Hard copies additionally were sent to the public for these potential affected facilities. Also the Restaurant Association was notified, as well as the regional chambers of commerce. We also went back and reviewed engagement levels from outreach conducted prior to the April governing board meeting. And for both the public workshop as well as the governing board announcements, we were able to confirm that between 16% and 39% of the recipients actually opened the emails with these announcements and information on proposed new rule. Next slide, please. The enhanced outreach was pretty successful. It led us to several key outcomes. One of them being new restaurant information that was gathered through additional surveys, which resulted in updates to the potentially affected facility list. We also revised baseline emissions as well as the reduced emissions expected. We did minor administrative edits to 3 of the 4 proposed rule actions under consideration today. The enhanced outreach also confirmed that there was a strong interest in the subject matter, that notices and reports were being reviewed, and that businesses were aware of the proposed rule in today's governing actions. Minimal negative feedback was received regarding proposed new rule. The additional outreach also allowed us to determine that a phased-in approach to the proposed rule for small independent businesses is not recommended. This is due to the many exemptions we have included in the rule, as well as the small number of affected small businesses and the long lead time for applying and installing emission controls. And most importantly, the urgent need to reduce PM 2.5 emissions in our region. Next slide, please. The estimated cost to purchase and install one of these catalytic oxidizers is approximately $2,500. This does not include installation or maintenance. As mentioned before, this type of control is very unlikely to require any structural changes to the restaurants to be able to install it and operate it. We do anticipate most facilities will be able to install this type of equipment, as it is it's a less expensive device and it achieves cost-effective emission reductions in our county. Initial air permitting costs would be around $2,000, but these costs should decrease. They should decrease annually with renewals. Coupled with a long lead time of 18 months to install these emission controls, we believe the costs are very cost effective, and it would cost much more to achieve the same emission reductions if it were from a different source category. Proposed new rule is expected to reduce approximately 14 tons per year of PM 2.5 and 4.5 tons of VOCs per year. This means about 80% of reduction of PM and VOCs emissions coming from this source category. And this is equivalent to removing approximately 75,000 vehicles from the road. Additionally, we have used EPA's COBRA's tool to translate these reductions into health benefits, which result in reducing up to 240 minor restricted activity and lost workdays, and up to 125 negative health incidents such as asthma and bronchitis, while contributing as much as $6.3 million to the economy annually from avoided health care costs and lost productivity. Next slide, please. Excuse me. Of the 137 facilities we noted in the staff report, that might have a chain-driven charbroiler. Approximately 66%, which 2/3, are nationwide well-known fast food restaurants, including Burger King, Carl's Jr., Dairy Queen, and Foster's Freeze. Only one smaller independent location confirmed ownership of this type of equipment, but they did note that they haven't used it in years, so they would likely just get rid of it. For the remaining of the 45 facilities that we noted in the staff report, we were able to conduct additional research recently to verify if these facilities actually operate this type of equipment. During this additional research, we did confirm that most of these small independent businesses identified that they don't operate this equipment. Instead, they use a flat top griddle or under fire charbroilers. Therefore, they would not be subject to rule. Only 6 small independent restaurants that we believe could be potentially affected. We weren't able to confirm their type of equipment they use. However, if the proposed rule is adopted today, we will continue to reach out to these locations to determine if they might be able to be subject or not. While the exact number of these facilities affected is still our best estimate, our research has found that the proposed rule will mainly impact franchise and national chain restaurants and not so much the small independent businesses. Next slide, please. The compliance schedule for proposed new Rule 67.26 includes the following deadlines. The rule will become effective in the governing board if adopted today. After today, any owner of a new chain-driven charbroil would need to submit an application for registration or a permit to operate if they wish to install it here in San Diego County. Additionally, record-keeping requirements would go into effect immediately if adopted today. The first deadline to comply would be 12 months from today or August next year, which would apply to owners of existing chain-driven charbroilers subject to proposed new rule. These owners of existing equipment, they would need to submit an application or registration or for a permit to operate by August next year, which would require documentation of the emission control device being installed. The second and final deadline would be in February 2027, or 18 months after rule adoption, to have the emission control device actually installed on these existing chain-driven charbroilers subject to the rule. Next slide, please. If proposed new rule 67.26 is adopted today, we commit to continue or enhance outreach and engagement with affected facilities. Also, a compliance advisory will be created and sent out, which would be informing the stakeholders and about the governing board's action today, as well as important dates and deadlines that they would have to meet. This compliance advisory would be emailed to all the potentially affected facilities, posted on our website, and also we'll be sending hard copies as well. Our existing business assistant program would assist with any courtesy inspections, permitting assistance, and our training opportunities that are needed by restaurants or owners or operators of this type of equipment. This could also include training videos specifically created for the restaurant industry. We would also continue to try and work with the Restaurant Association moving forward. Next slide, please. Staff believes, staff believes the proposed action today is meaningful, cost-effective solution to reduce air pollution and benefit several communities in the county. Enhanced outreach conducted since April informed several facilities and collected their feedback, which resulted in minimal negative comments. Today, our staff recommendations today are to first consider and find that the proposed new rule and associated amendments will not have a significant environmental impact pursuant to CEQA requirements. Second, adopt the corresponding solution. And finally, direct the Air Pollution Control Officer to submit required documentation to CARB and EPA for inclusion in the state implementation plan. Next slide, please. This concludes my presentation today. The floor is open now for any questions. Thanks for your time and attention. Thank you.
Thank you, Miriam and Nick. Appreciate all of the work that went into this presentation. With that, we'll go ahead and turn it over to public testimony. I think we have one speaker.
Thank you, Chair Bush. We have one virtual caller, Truth. You have 3 minutes to address the board. Please begin by stating your name for the record and self-regulate your time using the timer on your screen.
Hey, thanks. It's Truth. Requiring businesses to pay more application fees and more permits and to buy and install 5,000 or plus catalytic oxidizers is to ensure more profit losses to put them out of business, and it's going to result in even more businesses leaving the state of California. Targeting charbroilers owned by commercial operators is another trick to tax successful businesses who use what APCD just admitted is critical machinery for efficiency. How does APCD know that the businesses who said they don't use the equipment didn't lie about that because they don't want to be taxed? The math on this made up 450-pound number translates to only 59 one-pound burgers sold per week. That's nothing. Some people eat 2-pound burgers. That could be only 28 burgers sold per week. If all a business sells is burgers and fries, it will disproportionately harm and discriminate against their business. What is APCD going to do when businesses start suing this agency for discriminatory policies, including against Middle Eastern and Vietnamese businesses? Is there exemptions, at least on non-chain businesses? Only 8 people were reached via APCD's in-person public outreach. That's a failure. Has APCD reached out in several foreign languages to inform different communities about a new APCD meat tax? This nonsense will have a significant effect on costs for food operators, which means we're all going to pay more to eat. Things are already too expensive, but I guess APCD wants them much higher. APCD is targeting chain machines now, but what will be targeted later? But maybe with Paloma's great lack of accountability idea, everyone in the county can get an APCD air purifier to protect them from these invisible charbroiling fumes. Maybe you won't even need the tax. No matter what the health risk is, I still encourage people to visit Imperial Beach and eat tons of bonehead burgers, because it's not the circumstances that make a community, it's the people and food. So no to the burger tax. I'm going to go eat after this, and for the record, I never said no to a state of emergency. Newscom's the one that said no. Deal with it. Thank you.
Thank you. That concludes public testimony on this item.
Okay, with that, any questions or board member comments on this item? Again, this is something we brought back, and I appreciate staff for bringing this back with more detail and additional outreach to businesses. So any comments, questions? Yes, Vice Chair.
Thank you so much for the in-person visits to some of the smaller retailers. I know that was one of my big concerns the last time this was brought up. So I did want to thank staff for listening and actually following up on that. So thank you.
Great. And was that a motion? Would you like to make a motion to approve?
I'd like to make a motion to approve, please.
All right, we have a motion on the floor. Can I have a second?
Second.
Okay, second by member Campbell. With that, we'll go ahead with a voice vote. All those in favor of this item, please signify by saying aye.
Aye.
Any opposed? Any abstentions? That passes unanimously.
Thank you. That motion adopts a resolution entitled Resolution Adopting Proposed New Rule 67.26, Commercial Charbroiling Operations and Corresponding Proposed Amendments to Rules 11, 12, and 40 of Regulations 2, 3, and 4 of the Rules and Regulations of the San Diego County Air Pollution Control District, with members Fitzgerald, Gomez, and Lawson Reamer absent. That motion passes with all board members who are present voting aye.
Great. Moving on to item D4, Incident Response Plan Update and Alert and Warning Memorandum Agreement. Clerk, can you please provide the public testimony instructions while we have a staff presentation by Deputy Director Domingo Vigil?
Thank you, Chair Bush. I would note for the record that per the Governing Board Rules of Procedure, the submission period is closed for requests to speak on this item. All public testimony will be heard at the conclusion of the staff presentation.
Good afternoon, members of the board. I'm Domingo Vigil, Deputy Director with the San Diego County Air Pollution Control District. With me is Dr. David Soderman, Chief of our Monitoring and Technical Services Division. Today, we would like to provide an overview of SDAPCD's updated incident response plan. We are also bringing to the board a proposed memorandum of agreement with the county's Office of Emergency Services that would allow SDAPCD to request initiation of wireless emergency alerts and Alert San Diego campaigns to the public and businesses within San Diego County via the county's OES mass notification system during emergencies. Next slide, please. SDAPCD's recent efforts in addressing odors from cross-border wastewater flows in the Tijuana River Valley, among other incidents, highlighted opportunities for reviewing and updating the incident response plan to ensure SDAPCD's role and response capabilities are clear to first responder and support agencies, emergency response coordinating bodies, and the public. At the December 12, 2024 Planning and Policy Committee meeting, SDAPCD staff presented areas of opportunity to update the incident response plan, which included reviewing and updating roles and capabilities of partner agencies, reviewing and updating internal and public-facing communication processes as needed, ensuring incident response capabilities are up to date, and conducting additional outreach to partner agencies regarding SDAPCD's role and capabilities. Today's overview of the plan incorporates all the updates mentioned above. I will now turn it over to Dr. David Soderman, who will provide the overview of the updated incident response plan.
Thank you, Domingo. Next slide, please. APCD defines an incident as any release of air contaminants into the environment that may cause adverse health consequences to the public and results in a multi-agency response. Examples of past incidents include the 2021 Orange County oil spill, the 2020 Navy ship fire, and the various large wildfires that occur in our region in 2003, 2007, and 2015. Examples of non-incidences include dust, nuisance odor, or asbestos complaints, and smaller structural and brush fires. For air quality complaints related to dust and odors, members of the public can call our complaint line. I would like to point out that non-incidences could become an incident over time. For example, all wildfires initially start as small brush fires. Another example is the unprecedented amount of untreated transberry sewage in the Tijuana River Valley. If a member of the public happens to come across an incident and there is an immediate health threat, please call 911. On a later slide, we will address how APCD is informed of an incident. Next slide, please. When an incident occurs, an incident or unified command is set up. The purpose of the unified command is to have the various agencies that are responding to the incident work cooperatively with one another. The unified command is led by 2 or more unified commanders with assistance from the public information officers, safety officers, and liaison officers. The unified command oversees 4 main groups: operations, planning, logistics, and finance. Air districts, along with public health agencies, are organized into the Public Health Assessment Unit within the planning group. This assumes that a public health assessment unit is created by the Unified Command, as this unit is not officially a part of the FEMA Unified Command structure. Who leads the Unified Command depends on where the incident originates. It will typically be either a federal agency or the County of San Diego's Office of Emergency Services. The Unified Commander is responsible for bringing in the necessary agencies to respond to the incident, including APCD. The Unified Command will be responsible for the initial notification to the public regarding the incident and how to protect themselves. I would like to point out that there is no incident in which APCD would be the lead agency. In every incident, APCD would be a supporting agency. Next slide, please. One of the first actions that the incident command will take is the establishment of the hot, warm, and cold zones. The hot or exclusion zone is the area around the incident that is considered hazardous and requires specialized safety equipment and specialized training. Only authorized personnel mitigating the incident are allowed in this zone. This means that the incident commander will not allow APCD personnel to enter this zone for sample collection. I would also like to point out that APCD does not have the right equipment, training, or employee classifications to work safely in the hot zone. The warm or decontamination zone is the area that incident responders enter and exit the hot zone and where decontamination activities occur. Limited access is allowed in this zone and some protective equipment is required. The cold or support zone is the area around the incident where no protective equipment is required and where support services can be staged. Please note that while there is no immediate threat to life or property in this zone, impacts to health may extend into this zone. This is the zone where APCD would be collecting samples for analysis. Next slide, please. APCD executive management is available 24/7 to be notified by the unified command that an incident has occurred. APCD executive management would notify the appropriate staff. The staff will evaluate the incident information to determine what our response should be and what resources, if any, should be deployed. If an incident doesn't rise to that level, staff will continue to assess the incident for any changes and will reevaluate if deployment of resources are needed. APCD will be in close contact with the Unified Command and coordinating public messaging. Next slide, please. Each incident is unique and the deployment of resources must be decided on a case-by-case basis. Once the decision is made to deploy ambient air monitoring, several factors must be considered and decided on. This includes where the sampling location should occur. Does the equipment require plug-in power? What security measures are needed to prevent theft and/or vandalism? How big is the equipment? And do we have an agreement in place with the property owners to place our equipment on their property? Once on site, we need to set up the equipment, install and set up security measures, calibrate the instrument, and set up the communication system so we can access the data. The determining factor in how long it will take to deploy equipment will be getting an agreement in place with the property owner. This entire process, deciding to deploy resources to the point where staff have data available, will take at least 5 hours to several days. Next slide, please. What are our current monitoring capabilities? We have our regional and community-based monitoring locations located throughout the county with a wide range of instruments measuring many different pollutants. We will utilize any and all those appropriate sites during an incident. Our current deployable equipment can measure particulate matter smaller than 2.5 or 10 micrometers, black carbon, metals, toxic volatile organic compounds or VOCs. Black carbon is a byproduct of combustion and comes from diesel engines, gasoline engines, and wood burning, including from wildfires. Black carbon is a part of PM2.5, which are particles that are less than 2.5 micrometers in diameter. For reference, the width of a human hair is between 60 and 100 micrometers. These very small particles can penetrate deep into the lungs and aggravate breathing illnesses. Many metals and toxic VOCs are also cancer-causing agents. One thing to know, the black carbon and PM2.5 and PM10 data are measured every hour. However, the samples that APCD collect for metals and toxic VOCs must be analyzed in a lab and will take at least a week before the data is available. Lastly, we can also request additional equipment support from the California Air Resources Board or from EPA Region 9. However, since these agencies store their equipment in Northern California, it will take a few days after the request is granted before they arrive in San Diego for deployment by APCD staff. Next slide, please. This map shows the current locations of our monitoring stations. The sites in green are actively operating, while the blue sites are in various stages of planning and/or development. We expect at least 3 of the blue sites to become operational within the next 6 months, and we are hopeful that the last 2 sites will be up and running in the next 12 to 18 months. The circles, the sites that are in circles measure primarily the criteria pollutants, which we'll discuss on the next slide, while the square sites measure typically the toxic air contaminants. Next slide, please. So this slide here lists the various pollutants that we measure at our monitoring sites. Please note that not all sites measure all these pollutants, but almost all sites measure more than one of these pollutants. So the sites that are more dispersely scattered around the county typically measure the criteria pollutants, which are ozone, particulate matter, both PM2.5 and PM10, nitrogen dioxide, carbon monoxide, sulfur dioxide, and lead. The square sites that are located primarily around San Diego Bay and the international border typically measure the toxic air contaminants, which include toxic metals, black carbon, ions, hexavalent chromium, toxic VOCs, and so on. And a lot of our regional sites, the circle sites, typically measure some sort of MET data, wind speed, wind direction. Next slide, please. Other actions that APCD can take besides deploying sampling equipment is to issue air quality advisories. Examples include smoke advisories that are issued due to wildfires and odor advisories due to the transboundary flow of untreated sewage in the Tijuana River Valley. Additionally, APCD has developed and made available on our website various preparatory and informational guidance documents, links, and dashboards for two of the most common incidences that occur within our county, which is the wildfire smoke and odors from the Tijuana River Valley. Next slide, please. During an incident, all information from various responding agencies will pass their information through the Unified Command. The Unified Command will disseminate that information to the public. APCD will work closely with public health agencies and the Incident Command to ensure APCD's data will be presented in an easy to understand graphs, charts, and most importantly, language. Once Unified Command releases that information, APCD will help promote that message through our various social media accounts. Next slide, please. Lastly, our incident response plan also highlights actions the public can do to prepare and stay informed during an incident. They can download the SD Emergency app, subscribe to Alert San Diego, call 211 for general information during an incident, join APCD's listserv, and visit APCD's and EPA's website for general information for preparing for and taking actions during an incident. I will now turn it back over to Domingo to talk about our proposed alert and warning memorandum of agreement with the county's Office of Emergency Services.
Next slide, please. In response to the governing board's direction at its September 12, 2024 meeting, SDAPCD staff worked with the County of San Diego's Office of Emergency Services, or OES, on a proposed Memorandum of Agreement, or MOA, to provide emergency alerts in case of an imminent threat to public health from air quality issues. SDAPCD is not a first responder agency, and as a special district, we do not have the authority to issue life safety alerts. However, through this MOA, we may request life safety alerts to be sent through county OES. The MOA outlines the different alert and warning capabilities that the county is able to access during emergencies, clarifies roles and responsibilities for issuing alert and warning messaging during an emergency, which is typically done through the Unified Command during an emergency, and allows SDAPCD to request initiation of wireless emergency alerts and Alert San Diego campaigns to the public and businesses within San Diego County via the County OES mass notification system during an emergency. Next slide, please. Today's recommendation is for the governing board to authorize the Air Pollution Control Officer to sign the proposed alert and warning memorandum of agreement between the County of San Diego's Office of Emergency Services and San Diego County Air Pollution Control District. Next slide, please. This concludes our presentation, and we are available to answer any questions.
Thank you. Public testimony, clerk?
No public testimony on this item.
Okay, thank you. Any members of the board that wish to comment on this item or have questions? Yes, Member Aguirre.
Thank you, Chair. Could this be an opportunity to help communicate the need for the air filters that we've been talking about earlier? Could potentially be a two-way exchange of information through the county? Meaning not just, have alerts go out when we know if there's an incident. Obviously, the county is the incident command, but also potentially inform the public that especially those who haven't been able to access it on website or may not even know that their program exists, could that potentially be a mechanism, a vehicle to inform the public?
We can certainly explore that with OES. Typically, these systems are utilized during, emergency response, but we can certainly explore that with OES to see if that's an opportunity for us to reach out.
Yeah, my understanding, at least for the Tijuana River issue, that potentially, the affected jurisdictional areas obviously are the city of San Diego and the city of IB would be open to potentially looking at that.
Sure, absolutely.
Okay, any other questions? We do have a hard stop at 5, so we want to move on to the last item. So any other questions? Seeing none, can I have a motion to approve the staff recommendation?
I'll move with the caveat that we're going to look into the alert.
Okay, and I'll go ahead and second that motion. All those in favor, please say aye.
Aye.
Any opposed? Abstentions? Okay, motion passes.
With members Fitzgerald, Gomez, and Lawson Reamer absent, that motion passes with those board members who are present voting aye.
All right, and the final item, D5, support for continued funding for the Community Air Protection Program in the annual GHG reduction fund allocations. And that will be, clerk, can you provide the public testimony instructions, and we'll have our APCO, Paula Forbes, provide that presentation. And if you could just try to expedite it as much as possible because we have a hard stop.
We'll hit the highlights.
Thank you.
Thank you. The submission period for request to speak is closed on this item. All public testimony will be heard at the conclusion of the staff presentation.
All right, I'm going to whip through these really quickly. I think a lot of you are very familiar with our Community Air Protection Program, otherwise known as AB 617. So thank you, Chair Bush and members. We can move on to the next slide. This slide that's coming up talks about the different functions of the Community Air Protection Program. It's basically designed to reduce air pollution in the most impacted communities, and it's a unique program in California because, California's program is unique in that it focuses in these communities and does it in a community-driven way. So if we can go on to the next slide. We have 2 communities that have been selected to be part of this program, the Portside Environmental Justice Community and the International Border Community. And you can see here maps of those existing communities and also locations where we've installed air monitors as a part of this program. Next slide, please. And so, as I mentioned, a key component of the program is working directly with the community to get their suggestions as to where monitors should be located, as well as what emission reduction strategies we should be implementing. We've worked to adopt community emission reduction plans for both communities. Those have been approved by this board and adopted by CARB. And we're currently, in the process of implementing those plans. Next slide, please. So this just hits some highlights of some key program successes. I want to call to your attention, $25 million in AB 617 funding has been directed to clean air projects. That's resulted in 60 tons per year of NOx reductions, 2 tons per year of PM, and then 2,000 tons per year of GHG emission reductions. And I'll get to why that's important in a second here. And also, critically, this program has provided many opportunities for community engagement and participation. So next slide, please. This is why we're here today. Again, that's just a very quick and high-level overview of the program, but it is subject to funding challenges that are ongoing at the state level. So this program in the last 4 to 5 years has been funded out of what's called GGRF allocations, or Greenhouse Gas Reduction Fund allocations, that are the result of cap and trade auctions. So those cap and trade auctions have the proceeds of that have been what has paid for this program. At this time, the program has been zeroed out at the state level. In the governor's May revised budget and the final budget that was adopted, $1 billion of GGRF funding was reallocated to CAL FIRE. So it makes it much more challenging. We're working with partners across the state to advocate for ongoing funding for this program. We've made a commitment to these communities. We want to be able to uphold it, as do our partners around the state. And so this request is for us to be able to send a letter, next slide, please, to the governor's office and our local delegation, as well as any other appropriate legislators advocating for continued funding of this program, both in the immediate coming year, which we know is going to be challenging, as well as on a continuous basis, meaning getting a continuous appropriation of those GGRF dollars going forward. This is something that's previously been, every year it's been in our legislative program, so we could have just done this at the staff level. But I also wanted to elevate this issue to your board because it is such an important program for us. And I would, we're looking for support from not only this board, but other jurisdictions. So with that, I will, that concludes my presentation.
Thank you, Paula. Appreciate the expediting. Marvis, do we have any members of the public?
No, we received no request to speak on this item.
All right, with that, we'll go on to board comments and Member Campbell.
I move staff recommendation and thank you for the presentation.
Thank you. We have a motion on the floor by Member Campbell to approve staff recommendation.
I'll second. Did you want to suggest anything?
Well, I was just thinking like maybe, and correct me if I'm wrong, it could be even stronger if it comes from the chair of the board. That could potentially be something we consider.
Absolutely. It was intended to be on the behalf of the board, and so we're happy to have it come directly from the chair.
I think usually that sends a very clear message that this is a very high priority.
Yeah, absolutely.
I'm comfortable with that. Yeah. Anyone else have comments, Member Gloria?
Just very quickly, Mr. Chairman, on the advice of counsel from the California Air Resources Board, I've been advised to abstain on this matter.
Great, thank you. I'm fine with that just suggestion. Does anyone else have thoughts? I mean, so staff can draft that letter and then I can review it and then sign on behalf of the board. So does anyone have any objections or suggestions? Do you want to say that in form of motion then? Or did you already approve a motion? What was the?
Yeah, it just needs a friendly amendment.
There's a motion on the floor.
Okay. Oh, so okay. And then who's second?
And was second by you.
Okay. I forgot. I had forgotten that. Where am I?
You're trying to do
Member
Yeah,
Campbell.
dude.
Member Campbell, are you okay with amending your motion to include the letter being signed by the chair?
That's fine with me.
Okay. We have a motion and a second. All those in favor, please say aye.
Aye.
Any opposed? Abstentions? Okay. And Mayor, Member Gloria abstain.
Thank you. With Member Gloria abstaining and with Members Fitzgerald, Gomez, and Lassarimar absent, that motion passes with those members who are present voting aye.
Okay, we have 1 minute before we lose quorum, so we'll go ahead on the Air Pollution Control Officer report.
Thank you, Chair Bush and board members. I can provide a written update of my report. I'll just summarize it in the 15-second, the elevator pitch, which is still challenges at the federal funding level as well. So I'll send you all an update on that. Potentially some good news on some of our programs that are working their way through the Congress. And our chair and vice chair are coming to our service awards next week with an ice cream social for staff. So we're looking forward to that visit. So thank you.
Awesome. Thank you. And then anything to report from the Planning and Policy Committee from Vice Chair Burbeck Garcia?
Nothing to report.
Okay, so with that, we are adjourning. The next regularly scheduled board meeting is October 9th at 2 p.m. However, we are going to follow up with the special meeting in September, and I believe we were going to try to have the take the place of the committee, planning committee. Okay, and do you have the date with that off the top of your head so we can?
September 11th.
Okay, so September 11th, if everyone can mark the calendars and expect that invitation. With that.